Hi, this is Robert Rowland, and I want to bring you a presentation that's misleadingly titled, called "Everything You Need to Know About the Coronavirus." And obviously, there are things that researchers would like to know and doctors would like to know, and that we all might like to know. But in general, everything you really need to know about the coronavirus from a practical standpoint should be in this presentation. Um, there are so many misleading blogs out there and misleading articles in the mainstream media and misleading information by in news groups and on our next door neighborhood site and whatnot that I just felt compelled to make sure that we put all the good research together in one presentation and make sure that you really understand what this is, because this is life altering and life affecting. There's 110 slides in this presentation, so it's not going to be a short one, but it will ultimately save you time from going and reading a whole bunch of other things, because I've managed to collate all this in a consumable format. So I hope you'll listen to the whole thing. You'll pause it. Let me first of all give you a good required legal disclaimer, and that is that this presentation is for educational information only. Nothing in this presentation should be construed as specific advice to prevent, diagnose, or cure any disease or medical condition. It's solely for educational information. I'm not a doctor. I did work in the healthcare system for 4 years. I have a daughter working in a local hospital. I have moved from the medical field on to being a software engineer and educator. I'm a father of 8, a grandfather of 12, but I've put a lot of extensive and intensive research into this presentation. So I share it with you for any benefit you may derive from it. If you feel it's beneficial, give it a thumbs up on YouTube, and please share the link with other people so that they can get their facts straight too, and so we can all kind of be on the same page, sing from the same hymnal, as it were, in terms of what the facts are and where you can go and have an educated conversation with your doctor. So let's first of all look at kind of what we're going to cover. In order, we're going to look at what is the coronavirus. We're going to look at important numbers to understand and know what it is. We're going to find out how you get it. And when I talk about the numbers, by the way, there are two different numbers that are very important, and you'll hear the news media use one, government will use another, doctors will use another. So I want to make sure you understand what those terms are. How do you get the coronavirus? How does it attack your body? I'm amazed that most people don't understand how it attacks. In fact, I'm amazed whenever I go to the grocery store and see that we're sold out of toilet tissue, when this is a disease that attacks the lungs and not the bowels, and so you don't need extra toilet tissue. It's very, very rare that someone gets diarrhea with this. It does happen, but it's very rare. So people don't understand how this coronavirus works. I want to tell you how it can kill you and why timing for treatment is crucial. How can you prevent it? What can you do to boost your immune system? But also make sure you don't overboost your immune system. And I'll explain why, because it's actually your immune system that will kill you unless it's properly controlled. So we'll talk about that. How do you know if you've been infected? And if you're infected, what do you do? And then the elephant in the room question is the government doing the right thing with all the quarantines and shutdowns and things that we're doing right now? Now, so what is the coronavirus? Well, the coronavirus, corona means crown, and it's because if you look at a model of the coronavirus, it looks like a sphere with a bunch of little studs sticking out, and that kind of resembles an old English crown that had little studs on top of it for decoration. The coronavirus appears under an electron microscope, kind of like you see in the upper left diagram, where these little things are popping up off the surface of the virus. The actual name of the virus itself is SARS-CoV-2. Now, that's the name of the virus, and I'll explain that nomenclature more in just a minute. I think a more creative name for this is the one on the Peak Prosperity YouTube channel, where Chris Martenson, who I think is an epidemiologist by profession, he refers to it as the honey badger virus, because there's some YouTube videos of a honey badger named Stoffel, who no matter what kind of enclosure they put him in, he manages to escape. He gets in trouble in the zoo, and in this picture he's coming back from a battle with a porcupine, and the porcupine did not do well against the honey badger, and yet the honey badger doesn't seem to be bothered by all the quills that were stuck in him. So the actual nomenclature is SARS-CoV-2. SARS, we know right now it's politically unpopular to call this a Chinese virus or the Wuhan virus, and Trump has been criticized for referring it to that, but even when you use the actual nomenclature, you're referring to the geography, because SARS stands for Southeast Asia Respiratory Syndrome. And we have had a previous epidemic, a SARS epidemic, and that also originated in the same area where this has originated. CoV just means it's a coronavirus due to the structure of the virus itself, and 2 means this is the second SARS coronavirus we've encountered. By the way, sometimes you'll see a third term. You'll actually see it called novel SARS-CoV-2. Novel just means new, meaning it's something that is not natural to humans. It's not part of humans. We don't have any natural immunity to it, so if you're exposed to it, you're going to get it because there's zero immunity to this, and it crossed over from another species to mankind. Now, the disease caused by SARS-CoV-2 is called COVID-19. So once you've been infected by the SARS-CoV-2 virus, you can develop the COVID-19 disease, which attacks your lungs. But the COVID-19 is not the name of the virus, and people in the media don't get that right. Now, there are 2 types of coronavirus predominantly. There's type S and type L. Type S was the kind we first started seeing in Wuhan. But it's now only about 30% of the strains that are out there. Type L is about 70% of the strains are out there, and it is a more aggressive kind. However, type L is the kind we want to prevent the most, and it does respond well to containment efforts. So that's why quarantining in place and wearing masks and things of that nature are much more effective against the type L virus. Now, it is not the flu, and you're going to hear people all the time, and I get newsletters all the time saying, why are we shutting down the economy because this isn't as bad as the flu? And in reality, they're partly right. The flu does kill more people than the coronavirus at present. So worldwide, right now, the flu kills somewhere between 291,000 and 646,000 people annually, depending on how virulent the flu is that year. Flu deaths in the United States range somewhere between 12,000 and 61,000. So you see, and I think this was from last year, there were 29 million instances of the flu with 280,000 hospitalizations and 16,000 deaths from it. So the flu is not to be taken lightly. But the coronavirus can have a greater fatality percentage, and I should have said mortality percentage, because I'll make a differentiation here in a moment between fatality and mortality, because they're 2 different things in terms of the math. But according to the World Health Organization, which at times is about as useful as a milk bucket under a bowl, the mortality rate among people is 3.4%. But that's higher than the fatality rate of 1% for the flu, 2.5% for the Spanish flu, which was the last really great pandemic in America from between 1918 and 1919 that killed roughly 350,000 people. Some of the other reasons it's not the flu is, first of all, the flu is a human disease, whereas the coronavirus came from an animal, namely a bat, and crossed over from bats into humans. But it has a much higher serious complication rate, about 15%. Get pneumonia, and about 5% require intensive care. It can be up to 20 times more deadly than the flu, and if hospitals are overrun and people can't be seen to as quickly as they need to, it could be up to 50 times more deadly than the flu. It has an R0 value, which is much higher than the flu, and I'll explain what the R0 value is momentarily, but basically it's a measure of how contagious it is. It spreads asymptomatically, so in other words, you can spread the coronavirus while you have absolutely no symptoms whatsoever. And you can actually be symptom-free for 14 days and be passing it on to everyone around you, which is what makes this so dangerous. It's spread by droplets, and it's airborne, so coughs and sneezes will aerosolize it or make it airborne, and that's how we get it. And it has a relatively long incubation period. You could not see any symptoms for 24 to 27 days after you had been exposed. So this is much different than the flu. If you cough or sneeze on a surface, the coronavirus can live on that surface, like if it was a solid countertop or a stainless steel countertop, for up to 9 days. Other surfaces don't last as long, so cardboard, paper, things like that, it has a very short life. So it's anywhere from hours to days, depending on the surface it's on. There's no natural immunity to this because it is not a human virus. So if you're exposed, you will get it. There's not really an option there. Now, if you got a really powerful immune system and you get a very small viral load, and we'll talk about what viral load is in a little while, then you might be able to go through it and never even know that you had it. However, if you get a large load, for example, someone coughs or sneezes directly in your face, you're probably going to get a pretty bad case of it because it will spread faster than your immune system can ramp up to it. There is no vaccine available for it now. At best, it's going to be sometime next year, and I think it'll be fast-tracked, and then you're going to have to wonder about how safe is it to take. But there's enough bad in the coronavirus that you may determine that a vaccine is appropriate. You can get this twice. It doesn't happen very often. Most everyone who recovers from this has an immunity they develop to it. However, if you do get a second exposure, it can be worse. Also, you can get over the coronavirus, but your lungs can be susceptible to bacterial infection after the coronavirus, and a lot of people are succumbing to a secondary infection after the coronavirus. Testing often results in false negatives. So right now I know a young lady who has been very, very sick, she and her child, and it's horrific. She has been on medication, but it took her 2 weeks to get a doctor to agree to even see her for this, by which time she was very, very sick, and yet she's had 3 tests, all of which show she's negative for both the flu and COVID-19, even though she has all of these symptoms. The good news for kids is that they're mostly spared. So if you're under the age of 14, probably nothing's going to happen to you. In fact, there's been no documented deaths under the age of 9. Younger people can recover from this and have some lasting problems with lack of lung capacity afterwards, so it is still a problem for them. But this affects mostly older people, and we'll show you that in a little while. Men get it more than women. It's about a ratio of about 5 to 3, so nearly twice as many. 60% more men than women get this. And it affects the lower lobes of the lungs, but the flu usually affects the upper lobes of the lungs. And the lungs are inflamed and filled with mucus, but the original SARS-CoV-1 virus had some fibrotic growths in it, and that's not true of this one. Now, it mutates constantly, and the mutations are small. It's a little bit like if you went to a copy machine and you made a copy, and then you took the copy and put it on the glass of the copy machine and made another copy, and you kept doing that 20 times. After you've done that 20 times, the copy will have degraded some, and that's what happens when the virus replicates. So it changes a little bit every time it replicates. The good news about that is it makes it very easy for us, looking at the genetic structure or the structure of the virus, to determine where it came from. So, for example, we know that almost every case in Europe today came from a single individual that traveled from China to Germany for a business conference. He met with 5 other people there, all of which got the coronavirus from him, and then they went back to various places. One went to Sweden, one went to France, and others went to other locations, and pretty much all of the coronaviruses in Europe came from that one single individual. In Washington State, the original case was in a nursing home, and then it's 6 weeks after that original case before we see anyone else in the general population get the coronavirus, but we know the coronavirus was moving around for 6 weeks pretty much undetected, infecting a lot of people from there. But we know that it all came from the same source. Now let's talk about some numbers, and these numbers, when you hear doctors or government talk numbers and they don't even match, your head will want to explode. So let's talk about some important numbers where they are. First thing is, I want to give you 2 places that you can go to get the current numbers in terms of infection. One is worldometers.info, and you can see the whole link there. And so, for example, in the world as of April 6th, we've had 1,272,862 total cases, and of those cases, only 264,490, or just over 250,000, have recovered, and there have been a total of about 70,000 deaths out of that 1.2 million. So a lot of people have already lost their lives over this. And in the U.S., you see we're about 336,000 active cases, and we had 25,000 new cases since yesterday. These numbers are updated daily. We've got just over 9,600 deaths. Nearly 18,000 people have recovered, and I'll talk about the significance of these numbers again in a moment. And then you also notice, if you go over a little bit to the right, we're getting about 1,017 people infected for every 1 million in population. So that's roughly 1/1000th of the people. That number is going to grow substantially, but right now, not that many people are being infected. It's like 1/1000th of us, and it seems like our whole society's in a tizzy over this. And by the end of this presentation, maybe you'll decide whether the present regulations and things are appropriate, or if we've overdone it. But I do think that number of cases per 1 million population is going to grow substantially, and I'll explain why. And then deaths per 1 million population. Right now, 29 people are dying for every 1 million. So, for example, here in the state of Texas, we've had about 900 deaths, and we've virtually shut down our economy in the state of Texas for those 900 deaths. And again, the question is whether that's an appropriate response, and we'll look at both sides of that issue momentarily. Another good place to go is you can go to Johns Hopkins University, jhu.edu, and medicine, and they have a coronavirus map, which lets you see on a map kind of the geographic distribution. So, for example, you see that it's the coastal cities in Australia that get it, and that's because there's not a whole lot of people in the bush to spread it. So you can kind of look at this, and you can see, for example, the eastern half of the United States has this much worse than I'll say the west central region, and then it gets worse again on the western coast of the United States. And you see in the southern, below the equator, we're not seeing as many places, so that may suggest to us that warmer weather will cause this virus to slow down. So it gets nice and hot here in Texas where I live, and so when that happens, I'm hoping that means that the coronavirus will slow down and we can resume some sense of normalcy. We need to talk, though, about a very important term of what a resolved case is. So a resolved case is a case that's no longer active. There are two ways that cases get resolved with someone who got the COVID-19 disease. You either recover or you die. And either one of those is a resolved case because it's no longer active. So it's important that you understand what a resolved case is, and it means one of these two things will happen. So you're going to hear two different terms, mortality rate and case fatality rate, but they mean totally different things. So to get the mortality rate, you divide the total number of deaths by the total population at risk. So we would take the total number of people that died in the United States of 9,600, and we divided that by the entire population of the United States, and that would give us the mortality rate. And that would be a very, very small number, and we'd hear that and we'd think, oh, what are we getting so upset about? This is such a small thing. But we get the case fatality rate, and you divide the total number of deaths by the total number of just closed cases. These are cases that have been resolved. They're cases that are no longer active, and that means it's the total number of people who have died plus the total number of people who have recovered. That gives you your total number of closed cases. And it's very different. So let's get two examples to help you understand. Now let me talk a little bit again about case fatality. You first of all have to find out how many cases are no longer active. So you take the total cases that you have now minus the total active cases, and that gives you the number of resolved cases. And the reason we can't include active cases in our calculation for case fatality is if they're active, we don't know how they're resolved. They're ongoing. There's people that are still being treated, hopefully getting medication, hopefully staying at home and getting well, but we don't know how they're going to resolve. So you can only use resolved cases to figure the case fatality rate. So you take the active cases, you subtract that from total cases, gives you resolved cases, and then you divide the number of deaths by the resolved cases to get the case fatality rate percentage. So let's look at that in Italy, and this is current as of April 6, 2020. So in Italy, they've had 15,887 deaths, and they have a population of 60.48 million people. So if we do the math, that's like 0.26% of their population. So that really doesn't sound bad. That's like 1/4 of 1% of the people die from coronavirus. Well, that's 1/4 of 1% against the whole population. That's not 1/4 of 1% of people that got the disease. That's a whole different number. So you will hear government trying to keep us calm, and they will quote the mortality rate. And I'll show you, I think I have a slide with a quote from a government official to illustrate that very point. But that tells you the current mortality rate. It doesn't factor in how this is going to change as more people become infected. Now, the case fatality rate is something more sobering for those who have the disease. So in this case, we take 15,887 deaths. We know that in Italy, they've had 128,948 people diagnosed with COVID-19, and 91,246 of those are still active. So we can divide 15,887 by the difference between diagnosed cases and active cases. That gives us 37,702 cases, and gives us a case fatality rate of 42.14%. What that means is that 42% of the people that were diagnosed with COVID-19 and they no longer are active died from it. Now that is a sobering number. So you can see why government wants to quote the mortality rate, because 0.26% doesn't sound very bad. But when you say, hey, 42% of the people that had COVID-19 and don't have it anymore don't have it because they're dead. And that makes it a much more sobering statistic. Now let's look at the United States. So the mortality rate is at 29 out of 1 billion people in our country have died from COVID-19. So that's a very, very small number. Divide 29 by a million, and you're going to get a whole bunch of zeros in front of the 29, and this number again is going to change. But let's look at the case fatality rate. So we've had 9,624 deaths as of today. We've had a total 336,907 cases. Now bear in mind, there's probably a whole lot more people that have been infected. These are only people that have been tested and are positive. So our number would be skewed quite a bit if we knew how many people were actually infected, and it could be 5 to 10 times more than that for all we know. But if we take the statistics, the total cases minus the 309,306 that are still active, that says that we divide 9,624 deaths by the 27,601 cases that have been resolved. Again, resolved means they're either cured or they've died, and that's a 34.87% case fatality rate. That means of the cases that have been resolved in the United States thus far, a little over 1/3 of those cases resulted in the person dying. While as we can do the reverse math for the with the recovered statistics, and we can see that 65.13% of resolved cases resulted in a recovered person. So I don't know how that makes you feel. If 65% recovery rate from those that have been resolved sounds good to you, that's wonderful. But 1/3 is still a huge number. So even though it sounds like we're making great inroads on COVID-19, the reality is, of the cases that have happened and have been resolved, there's still a horrific loss of life in terms of percentages. And when people compare this to the flu, they're not looking at the case fatality rate, because this is much worse. So let me give you an example again of government using quotes to mislead us. So this is Admiral Brett Giroir. He's the Assistant Secretary for Health at the Department of Health and Human Services in Washington. And he says the best estimates now of the overall mortality rate for COVID-19 is somewhere between 0.1% and 1%. That's lower than you heard probably in many reports. It's not likely in the range of 2 to 3%. So what he's telling you there is that we're probably only going to lose, only about 1% of our population is going to die, but he's saying mortality rate. And when he says mortality rate, overall mortality rate, he's meaning 1% of the total population of the United States, which is a huge, huge number there. But it sounds calming when he tells us in such small numbers. But again, he's not telling us that there is a 35% case fatality rate. So you need to understand there's a difference between mortality rate and case fatality rate. Now, another thing that's interesting is some countries just refuse to report their coronavirus rate. And so one country does not report coronavirus, so it looks like they have none, but they do collect statistics on something called acute respiratory lung failure, which is their name for the coronavirus. So by changing the name, it's kind of like if we rename it, then you won't know. And they don't report what they've renamed, and also governments don't report what they haven't tested. Now, so the case fatality rate is very discouraging. However, we also need to be careful we don't go too far in the other direction with the projections. So this is a chart that was published by the Center for Disease Control in 2006, and it rates pandemics. And basically, it says if the case fatality rate is greater than 2.0, which it definitely is in the case of the coronavirus, you have what's called a Category 5 pandemic. And they estimate that the number of deaths from a Category 5 pandemic in the United States is going to be greater than 1.8 million people. Well, that's a huge number. That's a big deal. However, you have to kind of go down to the fine print of the chart to see that it assumes a 30% infection rate. That is, 1 out of every 3 people gets sick with the coronavirus, and there's no intervention, meaning they don't see a doctor, they don't go to a hospital, they aren't given drugs, they just cope it on their own. And yes, if we all did that with this disease, there would be a very high death rate. So hopefully we're going to get competent medical help. But you just need to pay really, really close attention to this whole concept that we're talking about here. That this doesn't have to be an awful, horrible, terrible number. It really is going to be affected there. So, how do you get the coronavirus? And this little hand drawing gives you the central truth, and that is the coronavirus has to get to your face somewhere. It has to get to your face. So I saw a Facebook post from one of my own family members the other day that they were concerned because they had slit their finger, and now they were worried that the coronavirus was going to get in through their finger. That's not happening. Okay, so how do you get it? It's got to get on your face. It has to go in through your mouth, nose, or eyes. The coronavirus cannot enter through the ears. You can pick up the coronavirus on your skin when you touch something that's contaminated, but it's not going to get you sick unless you take your hand and touch your face. And on average, most of us touch our face 5 to 7 times every hour. We're brushing the hair back, we're scratching our nose, we're rubbing something out of the corner of our eyes, something like that. But until you take the contaminated hand and you touch your face, you can do anything you want to with your hands. You can touch everything on your desk, everything on your countertop. It's not going to make you sick until you touch your face. It's got to come in through the mouth, nose, or eyes, because that's its path into basically the inside of your head, where it can get in your trachea and get down to your lungs, which is where it wants to be. Okay, so this is why hand washing is a big, hairy deal. It's why we need to be washing. It's of paramount importance. You need to do it often. In fact, as I would encourage you, even if you're just working at your desk, just make a practice, because you are going to touch your face. You've probably been to touching other things like doorknobs and things you're not aware of. Just make a practice of washing your hands, not only every time you go to the bathroom, but maybe just every time you get up to stretch your legs. Go wash your hands. Now, you can be coughed or sneezed upon. This is why you need to wear a mask. The only way to slow this down is first to all wear a mask every time we're outside of our homes. Now, if you have been exposed to the coronavirus and you know it, you should be wearing a mask now so that you're not coughing on other people. Now, by the way, sneezing is not actually a symptom of the coronavirus. It's just that sometimes we sneeze for other reasons. But sneezes happen for colds or allergies, but you do not sneeze as a symptom of the coronavirus. However, you will cough, and you will cough a lot with the coronavirus. Now, why does this spread so much faster than the flu? So there's a value that scientists have. It's called the basic reproduction number, or they refer to it just as R naught. Usually the 0 is lower than R, as you'll see on the next slide. This is an estimate of the average number of people who catch the virus from a single infected person. So if you have an R naught value less than 1, the disease will die out on its own, because it's not spreading fast enough, and it's just going to die out. If you have an R value of 1, the disease will maintain itself, because every person infected infects at least one more person. The flu has an R naught value of about 1.3, so each person infects about 1.3 other people. The coronavirus, depending on And this is different. It depends on the weather. For example, the coronavirus loves cold weather. It would like to be between 42 and 52 degrees Fahrenheit all the time. In fact, is once you get over 80 degrees, the coronavirus doesn't really survive on surfaces very well at over 80 degrees. Now, you could still be coughed on by somebody that had it during the summer, and you could still get it, but surfaces that are over 80 degrees are not likely to have the coronavirus on it very long, because it'll just fall apart. Now, you notice I don't say die, because a virus is not a living thing, and there is some debate about that, but in general, it's just this bit of genetic code that has a mechanism to copy itself, but it's not actually alive, so it's not correct to say we killed the virus. No, you didn't kill it, because it wasn't really alive to begin with. But the coronavirus has an R0 value somewhere between 3 and 6.72, and I think it's on the higher end of that in colder climates. I think the further you go south, like in South America during their summer there, while we were having winter here, it had a very low value. Now what you're starting to see is South America starting to see more cases, because they are moving into their fall and winter, as North America is now moving into its spring and summer. And so we're going to see the geographic distribution of this virus shift. So it is affected some by the weather. It's affected by a lot of other variables too. For example, how quarantined are we, and how successful, and this is why the government's trying to quarantine us, is it's trying to reduce this R0 value to a number we can control. Now, and you will hear this referred to often as flattening the curve, because if we all get it at once, we're all rushing to hospitals, and the hospitals are overwhelmed, whereas if some of us get it now, we go to the hospital, we get help, or we see the doctor and we get help, and then a little bit later, as we relax some restrictions, some more people go out in society and they get it, but we're trying to control the number of people to get it, so that we're not overwhelming the hospitals and doctors, and we just all have this giant destructive epidemic in our midst. So again, here's a kind of a visual illustration of the R0 value. Hepatitis C, each person usually affects 2 other people. Ebola, which is a horrible disease, about 85% of people with Ebola die, but it's very low R0 value. Each person affects 2 other people, so it's pretty easy to go into a place where there's Ebola and impose strict restrictions on personal contact and stop the disease in its tracks. HIV or AIDS, each person tends to infect 4 other people, and that's largely due to behavior more than anything else. The original SARS-CoV-1 virus had a SARS value of 4. You'll notice that mumps and measles actually have a very high R0 value. So mumps has 1 of 10. Each person would affect 10 other people, which is why we give vaccinations for mumps. I had mumps growing up as a kid, because when I was growing up, mumps was a normal part of growing up. And I got it. My foster brother got it. My dad got it. And of course, it was a lot harder on my dad than it was on us as kids. And then measles. I was born with immunity to measles, because my mother actually had measles while she was carrying me. But measles here has an R0 value of 18, which is why we do vaccinate against measles, to contain the spread of it, because measles can actually be pretty damaging. So this gives you an idea of the R0 value, but right on this chart, SARS-CoV-2 falls somewhere between SARS and mumps. It's a significant thing. Now, what does this high R0 value mean? Well, it means that up until this point, you could each day take the total number of cases in the world, add a 0 to it, and about 16 days later, it's slowing down a little bit now, so it may be down to 20 days later, you would see that number. So in other words, if you had 200,000 cases, then 20 days later, you would have from 20,000, you'd have 200,000, or if you had 200,000, 20 days later, you'd have 2 million. That's about the rate that it grows. Now, in Italy, this is early on documentation. The first 2 cases were confirmed on January 31st. 28 days later, there were 655 cases, and so you can see that basically it doubles about every 3.3 days. And if you don't insulate, meaning you're not practicing quarantining, it doubles every 3.3 days. Whereas if you insulate or practice quarantining, excuse me, let me back up. It doubles every 3.3 days if you didn't isolate, then it would double every 2.4 days. And so what that means is the high R naught value means it's going to grow incredibly quick. Now, why is the R naught value of the coronavirus so big? Well, first of all, it's a human disease. The flu is a human disease, so we all have some natural immunity to it. Flu is a human thing, so we're pre-programmed in our genetics to have some immunity to the flu. Now, a lot of people get the flu because either their immunity is not very strong because their immune system has been compromised, or the flu has mutated and there's a new variation and it's not quite what our immune system recognizes. So we get a new variant of it, but we still fight it better than we would have because it is a human thing and we were at least partially adapted to it. The SARS-CoV-2 virus is a novel virus, means that it's not a human virus. It's new to the human condition, and so nobody has a natural immunity to it. And once again, if you are exposed to it, you will get it, period. You don't really have a choice because there's nothing in your immune system to prevent it. The question is, how vulnerable will you be to it, and will you get a small viral load or will you get a big viral load, and that makes it a difference. This is just an interesting, quick graphic to illustrate. So if one person infects every 5 days, infects 2.5 people, then in 30 days or after 1 month time, that one person is responsible for 406 people being infected. Now, if I can reduce that one person over the course of a business week of 5 days to only infecting 50% of that amount, 1.25 people, then in 30 days you've affected 15 people. So that's a huge difference. And then if we could get it down to where one person only affected 5/8 of people, 62.5% of a person. And so in other words, you didn't affect even a whole person every week. It took a couple of weeks to infect one person. Then in 30 days we might have infected 2.5 people. So this is the exposure. So one of the things our government's trying to do by having us quarantine and shelter in place is we're trying to reduce this effect. So social distancing is a powerful tool for fighting this virus. Now, what does the virus progression look like? Chris Martenson on his Peak Prosperity YouTube channel has this chart, and he says basically it all starts, here's a case, then you start hearing people say, don't panic, we got this, just wash your hands. Then you see case, and then you see a cluster of cases pop up here, cluster of cases pop up there, and then boom, you have this exponential growth. And the diagram to the right shows that the growth looks pretty flat every day, and then suddenly it starts coming up, and then it shoots off like a rocket going straight high, and that's an exponential progression. All right. You can expect a lot of extreme precautions, and we've already implemented this, so this is old news for you. I know IBM no longer has international travel. They don't let their employees shake hands. They're even cutting down on domestic travel now. There's no attending meetings of over 1,000 people, and now even smaller meetings are being canceled. There was a major conference in May. They're going to do that over the internet now. Nobody's going to travel to it. Austin, Texas canceled their big music festival that they have every year, and it's a major source of income for the city of Austin, but they're not doing it. And so it's prudent or an overreaction. You kind of have to decide yourself. Dr. Amesh Ajala about the coronavirus in the United States said, right now we've come to the conclusion that this virus is not going to be contained. So that means every country, every location really needs to prepare. And he's an infectious disease specialist. So this is why we're having all the shutdowns. Now, it spreads asymptomatically. So there was a study in the Journal of American Medical Association that details how this can spread asymptomatically, and it actually cites several cases. And so here's a particular case where it says a 20-year-old woman lived in Wuhan. She traveled to Anyang on January 10th. She met with patients 2 and 3 on January 10th, and January 13th she accompanied 5 relatives who were patients 2 through 6 to visit another hospitalized relative. There was no report of COVID-19 at the hospital. After development of disease in her relatives, patient 1 was isolated and observed. As of February 11th, so this is a month later, she had no elevated temperature, measured or self-reported fever, no gastrointestinal or respiratory problems, including cough and sore throat, reported or observed by the physicians. Chest CTs showed no significant abnormalities. Her C-reactive protein level was normal. So in other words, they did all these lab tests, and it looked like she didn't have it. and yet she was spreading it to everyone that she contacted. And so we have very specific data. And again, we can find out who you got it from by looking at the genetic structure, basically. So it can spread without symptoms. Here's another case where a family cluster of people got it, and it says that the 33-year-old woman and a 3-year-old boy that were giving to other people were asymptomatic, normal lymphocyte count, and chest CT images. By the way, you will notice a lot of these reports mention chest CT images because in addition to getting a positive coronavirus test, most of the time if you have a CT made of the chest or lungs, they will see what they call ground glass opacity in the images made by the CT scan, and that's a positive diagnosis for COVID-19. So it spreads without symptoms, and you can yourself have been infected for 14 days with no symptoms and have been contagious that entire 14 days. Then usually symptoms will show up by that time, and you're usually contagious for another 10 days beyond that. So you're usually contagious with this thing a little over 3 weeks, and we'll talk more about contagious in a minute. Well, here we are. So you can be contagious for 14 days with no symptoms. If you have a mild case of coronavirus, usually after you've had symptoms run for about 10 days, you're no longer contagious, even though you might not be over all your symptoms. So in that case, that 14-day quarantine might be appropriate for you to look at the symptoms, but the reality is a lot of us could be carrying it and not knowing it, since you can be contagious for 14 days and not have any symptoms at all. And that's what makes this such a difficult disease to contain. But once you do get coronavirus symptoms, just know that probably after about 10 days, you're not going to be contagious. If it's up to me, though, I'm going to be extra cautious and probably try to stay away from anybody for 3 or 4 weeks, just to be on the safe side. Now, some important data. This is just research again. There was a scientist in Berlin and Munich. It's one of the first clinical data outside of China. It said that the disease, the COVID-19 disease, basically showed that after about 10 days that people were not likely to be infectious after they started to experience symptoms. So this is actually encouraging in many ways. Now, how else does it spread? So it spreads asymptomatically without symptoms. The chief way it spreads is by airborne particles. And you will hear everybody saying you maintain a 6 feet separation, and we're under a shelter-in-place law here, and we're not allowed. If I go out to the park to play disc golf with my son and I can be together because we live under the same house, but we're not supposed to get within 6 feet of anybody else. The reality is coughs and sneezes could actually travel as far as 9 feet, and so what happens is the spray comes out the person's mouth or nose, and it travels on an arc as gravity acts on it, so it doesn't travel too far. But the cough and sneeze droplets can travel around 200 miles an hour, and that's usually not going to stop within 6 feet. So for that reason, if you're outside, other than at a park or you're jogging out in the open doing exercise, but if you're going into a store to get something, and don't do that unless you have to, but if you're going into a store or going to be around other people, wear a mask for 2 reasons. First of all, if you're spreading this asymptomatically, a mask will keep you from coughing virus droplets on others, and it will also keep you from getting coughed on by others to where it can enter your mouth and nose. Now, you still have the problem about your eyes, and it's a little impractical for us to all wear goggles. However, if you wear eyeglasses, that's going to provide some modicum of protection. But the big thing, and there are actually people in our society now that think they're being cool by going and coughing on people deliberately as a joke, and then later they find out they do have the virus, and they're arrested for 20 years for a felony assault, and it is a felony assault if you happen to do this to someone deliberately. Now, it can also be spread by surface contact. So they've done some research, and they found out that you need to probably decontaminate your bedrooms and bathrooms, since that's the area where you spend the most time breathing, or where there's the most likelihood for to have bodily fluids. I would say computer keyboards are another good place where you have a lot of contact, and maybe you're hovering over them all day. So you need to routinely clean those things. But it's pretty easy to do so. You can use a common disinfectant, and I'll talk about disinfectants here in just a moment in a couple of places in this presentation. But as long as you do that once or twice a day, that's really good. So think about where you are the most and how you can go about disinfecting it. And also, if you've got like an air cleaner in your house and it happens to have a UV lamp, and it will basically kill viruses or destroy viruses, is the proper term, as you're sucking the air through the air filter, that kind of thing helps too. But you need to be thinking about when do I want to put on gloves if I can't control whether something's complete or not. Maybe I need to carry a pair of nitrile gloves in my pocket and put those things on so that I'm not picking up something from a surface elsewhere. Now again, it really doesn't matter what you touch so long as after you touch it you don't touch your face. Problem is we do that unconsciously, and it's very, very difficult to control. So I've known some people that would put like a piece of duct tape around the palm of their hand, so as they're raising it, they think, oh, that duct tape there is a big reminder to me that I'm not supposed to touch my face. Okay, so that might be something you can do, but again, touching something with your fingers is not going to contaminate you until you take that contaminated hand and you touch your face. So you might want to just wear gloves if you can't control that. Okay. The SARS-CoV-2 sheds. In other words, it spreads itself readily. Every time you cough, it's going to send out billions of these viruses. And it's all around infected and infective persons. In other words, there are people who are passing the disease even though they don't have it. And it also can get in your air vents, so it's a good idea to clean your air vents as well if it's a place where you've got someone who is sick. So if, for example, someone's sick and they're in a room of your house, then it wouldn't hurt to wipe down the air vents with a disinfectant as well. Now, again, it can live on surfaces for up to 9 days. If you have masks, and it's really hard to get masks, but there are solutions for that. I'll show you in a few moments. You can have masks and you can rotate them. So in other words, if you had 9 masks for yourself, you could wear a different one each day, and by the 10th day, the first one will be safe to wear again because the virus won't last any longer than that. In fact, probably you'd be okay with 3 to 4 masks and just rotate them, and then when you put them up at night, put them in a paper bag because the virus doesn't exist well long on paper. Now, you can kill the coronavirus with several things. Hand and sanitizer. Amazingly, even though everybody's rushing out to get hand sanitizer, the virus can actually survive hand sanitizer by up to 5 minutes. Now, that's the extreme. Most of the time it doesn't, but it can do up to 5 minutes. If you wanted to clean your kitchen countertops or other surfaces, you could get Clorox or some other kind of laundry bleach. You can make up a 10% solution of bleach water, 10% bleach to the rest 90% water, and you can spray that on and wipe it down. That will kill it. Of course, if you have countertops that have any kind of resin in it, you don't want to do that because it'll cause your countertop to go yellow. There is a kind of a natural thing called EnviroCare neutral disinfectant. It's been proven to destroy the coronavirus. There's a disinfectant used in a lot of hospitals called CP64. If you can find that, you can use that. There's also a disinfectant called LabGuard 256. You can buy it in a spray. You can spray that down, and that will kill the coronavirus. I don't know about thieves' oil. A lot of people that use essential oils swear by thieves' oil, and it certainly seemed to work during the bubonic plague, if you believe the story that goes with it. I don't have any evidence that it would destroy the coronavirus. However, I think it's very probable that it will. The coronavirus has these bonds, as I'll show you in another slide. They're like Velcro, and oil or fat breaks them apart. And so when the oil comes into contact with it, the fat comes apart, it breaks apart. That destroys the shell that protects the virus, and then the virus falls apart like a stack of cards. So I'm pretty sure thieves' oil would work, but I just don't know that for a fact. Now, there are some disinfectant agents that reduce the coronavirus infectivity within 1 minute. So these are very effective. 62 to 71% ethanol. It's like rubbing alcohol. 0.5% hydrogen peroxide will also destroy the virus, and 0.1% sodium hypochlorite. Now, if you don't know what sodium hypochlorite is, that is concentrated bleach. So in other words, when you buy a jug of Clorox or laundry bleach at the store, that is already diluted bleach. You would mix that in a 10% solution of that to water. Sodium hypochlorite is undiluted bleach. If you're going to use it, only open it in well ventilated areas. Make sure that you have on rubber gloves, and you would mix it in a much smaller concentration, 0.1% concentration. So that would be a 1 part to 1,000. Let me think if that's right. Yeah, of sodium hypochlorite to water. Spray that on. All those will disinfect surfaces. So again, that's a valuable thing, and there is a prevention section. So I'll just refer you back to this later. So let's talk about something that I think is crucial to understand, and very few people understand. That is, how does the coronavirus attack and kill? It's all about the lungs. This is all about the lungs. So inside your lungs, you have these little tiny air sacs or air pockets called alveoli, and they kind of look like the cells on a sponge, and those cells open up and absorb oxygen, and they exchange gases. Now, on these alveoli, there are two kinds of cells on the surface of the alveoli. There are what they call type 1 pneumocytes. So anytime you see the word cyte, C-Y-T-E, in medical stuff, it means a cell. A pneumocyte would be a lung cell, okay? A monocyte would be a different kind of cell. An adipocyte is a fat cell. So anytime you hear the word cyte, cell. But a type 1 pneumocyte is the kind of cell in your lung that exchanges gases. So you breathe in, it takes the oxygen. These type 1 pneumocytes take the oxygen out of the air, which our air is 21% oxygen and 79% nitrogen. I think that's the right ratio. So it's gonna take the oxygen out of that and put it in your blood, and then it's gonna do an exchange and get the CO2, the carbon dioxide, out of your blood, and it's gonna exhale in that. And so its function is gas exchange. But also on these alveoli, you have another kind of cell called a type 2 pneumocyte, and this produces a surfactant. And think of a surfactant as kind of a gooey-like lubricant, because these alveoli are expanding and contracting every time you breathe, and your whole lungs are expanding and contracting. And if you look at that diagram to the right, you notice the top of the lungs goes almost all the way up to your collarbone, and then it goes down to the bottom of your rib cage, and sometimes even a little further if you're taking a really deep breath. And in order to do this constant expansion contraction, where you're actually going to have parts of the lung rubbing against other parts, you got to have this gooey lubricant to protect the lung tissue. So it's very important that you have both of these things. Well, the coronavirus attacks this type 2 pneumocyte, the part that's making this gooey protective part of your lungs. And on each of these type 2 pneumocytes is what's called an ACE2 receptor. ACE stands for angiotensin converting enzyme. And if you are taking blood pressure medicine, for example, a lot of blood pressure medications are what they call ACE2 inhibitors. And an ACE2 inhibitor actually is something that blocks a signal, a hormonal signal to your brain that tells your brain that you need to your heart needs to beat faster and it needs to beat stronger, because there's parts of your body not getting enough blood. So, and a problem, by the way, is if you're taking an ACE2 inhibitor, you're actually at a greater risk for the coronavirus, because it leaves more of these little open holes in your lung, or like you see these little yellow wrenches in this diagram. It leaves more of those yellow wrenches to which the coronavirus can attach. So, I think the greater risk right now is if you don't take your blood pressure medicine, you could have a stroke, and I wouldn't want you to do that. So I'm not recommending to anyone that they quit. But if you are taking an ACE2 inhibitor, and maybe you're a little older, it might be worth a discussion with your doctor as to, is there another kind of blood pressure medicine that wouldn't potentially raise your risk for getting the coronavirus. Okay, so that might be a discussion you'll have with a medical professional. Now, SARS-CoV-2 attaches to this ACE2 receptor, and once it's in that ACE2 receptor, it can get inside the cell, the type 2 pneumocyte, represented by this human cell semicircle that you see at the right of your screen. And then it replicates itself. It turns on a copy machine. It makes a whole bunch of progeny. It makes a whole bunch of copies of itself. And eventually, after it makes enough copies of itself, the cell bursts and dies. As these cells die, there's an inflammatory response. It causes inflammation. Your body says something is wrong. I've got to go deal with it. And so your body starts sending all these things to deal with the dead cells that are coming up, and it sends things like interleukin 1, interleukin 6, and I apologize, I misspelled that, tumor necrosis factor alpha, a lot of other things as part of the immune response. And oddly, this is what kills you. It's your body's own immune system, and I'll explain how in just a moment. So be aware of the fact that if you do go to the hospital, one of the things a doctor may do if you're kind of in the early stages of having some lung problems from coronavirus is they may give you steroids to help suppress your immune system response so that your immune system isn't working quite as hard to do that. And I'm going to tell you how you can do that without steroids here in a little bit, or at least help the process along. And then it will reduce inflammation, because what happens is when it gets inflamed, these alveoli, basically the tissues start generating a fluid. It's kind of like if you burnt your finger, you probably got a blister on your hand and it filled with fluid and it was trying to calm down the inflammation. Well, we start getting this fluid from the inflammatory condition, and then these air pockets that are supposed to process air suddenly instead are sucking in pus and debris, and it's fluid debris, and it's generated by the immune response, and you get pneumonia. And if you look at that lung x-ray to the right, you'll notice that the lung on the right here, the whole bottom left portion of that lung is filled with fluid. That's why it's opaque or white, and it's spreading rapidly toward the top. And you will often hear of people that have pneumonia in one lung or the other, and when somebody has it in both lungs, it's a really big deal. Pneumonia for this usually starts in the lower section of the lungs, because as you're standing or sitting, this fluid has a tendency to gravitate downwards, and so it fills from the bottom up. In the actual flu, it tends to affect the top of the lungs, but COVID-19 affects the bottom more than anything else. And then what happens, these air sacs, the alveoli, they get stiff, they die. It's kind of like if you've ever found not one of those hardware store or grocery store synthetic sponges, but if you've ever picked up a real sponge, like one from the ocean, if you squeeze it, it's really easy to squeeze when it's dry. But if you got it wet and it soaked in all the water and you wanted to squeeze all the water out, it takes a little more effort to squeeze it enough to get all the water out of it. And this is what happens in our lungs, that these things, it gets harder and harder to get the water out and get the air in. And this leads to our next condition, which is acute respiratory distress syndrome. And so the other alveoli are filled with fluid. They can't perform an oxygen exchange. You got a lot of your alveoli dying. Your lungs can't breathe. You start suffocating and drowning in your own body fluids. And if you're at the hospital at this time, they will intubate you, which means they'll put a breathing tube down your trachea or your windpipe into your lungs and put you on a ventilator, and the ventilator will breathe for you, because your lungs are going to get too tired. You're going to get to where your body can't do this. But at this time, it may be even too late. In fact, by the time they intubate people right now, about 50% of those people pass away. So it's bad if you get to the stage you have to be on a ventilator. Hopefully you'll recover, but it's usually not so. So again, if we were to look at a sponge, a healthy lung might more resemble the sponge on the left. It has lots of little tiny alveoli in it, and an unhealthy sponge might look more like on the right, that it's necrotic tissue. It's got lots of large holes. There's very few good small alveoli to perform the gas exchange. And that's a crude illustration, but hopefully it helps make a point. Now, so pneumonia is the vehicle that takes you from just having COVID-19 to dying. And depending on who you ask, about 80% of people that get COVID-19 have symptoms. About 3% of those people are going to die. And again, this is depending on whether you're using mortality rates or case fatality rates, two totally different numbers. So how you get from what feels like the flu to dying is pneumonia. It takes you from one to the other, and of course pneumonia changes into that acute respiratory distress syndrome. And the difference between pneumonia and ARDS is in pneumonia there's fluids inside the alveoli, but in ARDS not only is there fluid in the alveoli, but it's in the space between all the alveoli. It's called the interstitial space, and basically the lungs just can't do anything at that point anymore because they're totally full of fluid. So this timeline when you go to get treatment becomes crucial, and what you will often hear is the doctor will come and say something to you about your mother who has COVID-19, something like, we're worried that your mom's going to tire out. Now, tire out is doctors' politically correct speak for we don't think she can breathe on her own much longer, so we're going to say we need to put in a breathing tube, or they may say we need to intubate you because they assume you understand all their medical terminology. And that's got to happen really quickly. So if they tell you that, don't debate. Just put the tube in, unless the person has a do not resuscitate order or something. But just bear in mind that about 50% of the people that make it to this stage are not going to survive. The other thing that can happen is the lung problems start causing other problems, because if you're not getting enough oxygen, then you can get sepsis, which basically is kind of like dead tissue and infection everywhere, and it leads to other organ failures. For example, if your heart doesn't get enough oxygen, you have cardiac failure. Your liver doesn't get enough oxygen, you have liver failure. Your kidneys don't get enough oxygen, you get kidney failure. So the lungs are a big deal, and that's why this is such a horrific condition to get in if you let it go too far. So the key here is early detection, early response, early treatment. Now, even if you do recover, there are studies now that are showing that about 2/3 of people are going to have a problem, and that problem is going to be that they're going to have they're just going to have a reduction in their lung capacity. So you can see here it says. From this important report, about the fifth, sixth line down, we learned the virus can establish infection in the lungs where it produces tissue injury well before producing symptoms, including dry cough and fever that occur later on. At this early stage, the only clue of SARS-CoV-2 infection is imaging showing ground glass opacities in the periphery of the lung. That'd be like those white areas I was showing you on the lung a moment ago, but there's other talented radiologists can see this happening long before pneumonia is detected. And so you need a radiologist who knows how to look for ground glass opacity, and I'm not an expert on radiology, so someone else would have to describe that. But basically, most patients can recover if you do something with them when they first start getting a dry cough. However, it says, however, some experience disease progression, this bottom two lines, and their lungs contain large area consolidations. That's those white areas at the bottom. It's where all the fluid goes to one area, at which point there's severe loss of function leading to respiratory failure. So a lot of estimates say that you can lose 20 to 30% of your lung capacity in a permanent way. So even a young patient can recover, and but then they might not do well at athletics or something later because they have a reduced lung capacity. Of course, you can increase your lung capacity with exercise within limits. Now, so another thing that can happen even if you recover is that if you've got a strong immune system and it deals with the SARS-CoV-2 virus quickly, and the COVID-19 disease, and you get over it, it may be that that inflammatory reaction caused by your immune system could have damaged lung tissue, and now you get over it because all the viruses are dead, and we'll talk more about how that happens. It's mainly getting zinc into the cells, and that stops the virus's ability to replicate. But you could have recovered from coronavirus, but the damage from the inflammatory response would leave you more susceptible to a secondary infection. So in other words, bacteria that normally live in the nose, the throat, or maybe that were in the mechanical respirator you were breathing through too, can now lead to a secondary infection. So it's kind of like if the coronavirus didn't get you, an infection can. So you want to take all precautions. You don't want to get the disease. If you do get the disease, you want quick, competent help, and then you want to be aware of the fact that even when you're over the disease, you have to be extremely careful to not get any kind of infection. So what kind of things make you more vulnerable to dying from this? And the the big factor really is age. That's the number one factor. And so you see a death rate over here, and this death rate, if you read the page that these statistics came from, this is not talking about case fatality rate. It's basically talking about the mortality rate. But you'll notice that 80% of people that get COVID-19, if you're 80 years old or older, there's a 21.9% death rate of confirmed cases. But if we just look at those other numbers, the important thing to see here is the younger you get, the smaller the number becomes. So I'm at the age where I've got about a 1.3% risk. My wife's at the age where she's going to have about a 3.6% risk, but her parents that live next door to us are in that top category, which is why we want to take good care of them and keep them isolated from this as long as we have to, and if it means we've got to do shopping and things for them. If you've got an older person in your family, you need to bear in mind they don't need to be out in public, and if they do go anywhere in public because they absolutely have to, they need to be wearing masks. And they need to carry hand sanitizer with them, so everything they touch they can immediately come back and cleanse just immediately. When you grab a shopping cart in the grocery store, only go to grocery stores that provide sanitary wipes that you can wipe the handle off with, and anything else on the cart you're going to touch. Now, other factors can also make it worse. People with diabetes much more likely to succumb to this disease because they have a lot of inflammation in their body already, and this is going to add to that. If you have hypertension, that is high blood pressure, and you're taking ACE2 inhibitors, it leaves more of those receptors open in your lungs for the coronavirus to attach to, which is why you might want to have a discussion with your doctor about whether another kind of blood pressure medicine might work better for you until this coronavirus thing's under control. Pulmonary problems, if they've had pneumonia in the past, if they've had congestive heart failure, anything like that, that would indicate that they're more susceptible. And so if you know someone like that, you have to do your part to keep them isolated as much as possible from all this. So let's talk about ways to prevent it, because ultimately what we want to do is just not get it to begin with. And hand washing. I know we hear this all the time, but I want to explain to you the reason why hand washing is good. And I have to make a confession here. Almost every time I go to the restroom, I've got hand sanitizer sitting near, and I pump a little hand sanitizer and I clean. And also, you need to know, regardless of whether you're hand washing or using hand sanitizer, one of the things a lot of people don't do, you need to spread your fingers apart, interlace your fingers from the two hands, and then go back and forth so that the insides of your fingers are rubbing against each other and spreading this, because the one thing that most people neglect when they're washing hands or using hand sanitizer is to get the space between their fingers, and that's so crucial here. The reason this works is, you'll notice in this little picture off to the right, you see these little blue things on the diagram. Essentially, these are part of a fat membrane around, it's a lipid fatty bilayer that surrounds the virus, which is that curly thing that you see in the middle. Well, when you use soap, they have fat-like substances called amphiphils in it, and they're very structurally similar to these lipids, and they compete with the lipids in the virus membrane. And what happens is, you use soap long enough, and the saying is, sing Twinkle Twinkle Little Star to yourself, or the ABC song, which by the way are the same tune, and by the time you get through the whole song, you've let the oils and fats in the soaps compete with the fats in the layer around the membrane enough that it's like these Velcro like links come apart, and it opens up, and there's no longer a membrane there to protect the virus, and the virus falls apart like a stack of cards. And so soap hand washing is extremely effective. It's not just something the government's telling us to do to soothe our consciousness. It actually has reason. Now, hand sanitizer works. It doesn't work as well as soap, and I like hand sanitizer. It's more convenient for me. It's better on bacteria, but soap is better on viruses. And of course, there's some other concerns about hand sanitizer and some of the chemicals you could be absorbing. I don't really worry about that much, but just be aware of the fact soap works a lot better. It loosens the glue that holds things together. Now, some other practical tips. It's really hard to get hand sanitizer right now. Soap should still be available. You use bars of soap. You can use a high fat content soap, like Ivory soap or something, would be great. If you want to make your own hand sanitizer, you can get aloe vera gel, and you can get 100% alcohol, like rubbing alcohol, or liquor stores. For some reason, liquor stores are allowed to stay open because they're considered an essential business. I don't understand that, but you can get Everclear there, and you can mix it together, make your own hand sanitizer. There's recipes on the internet for that. Now, it's really hard right now as I do this, and hopefully this won't last long, but as of April 6, 2020, most sites like Restockit.com, Amazon, all your stores are out of hand sanitizer. If they got some more in, it'd be sold out before you had a chance to get there. However, I found it very interesting that I was able to get 2 1-gallon jugs of Hibiclens from Amazon. And if you've ever had surgery, you were probably told to take a shower with Hibiclens and wash the area where they're going to be operating with Hibiclens before you got to the hospital for your surgery. Hibiclens is surgical soap. Now, the only areas you can't use Hibiclens on, you can't use it on your private parts, and you don't want to use it on your face because it's not really kind to mucus areas of your body, okay? But it will kill viruses, or destroy viruses, and kill bacteria. Now, again, if you're worried about, I want to keep some healthy bacteria on my skin, I want a good healthy skin biome, then you don't want to be using hand sanitizer or Hibiclens. You just want to use soap. So soap and water is still your first and best defense, but if you're desperate for something that you want something a little stronger, you may still be able to buy Hibiclens in your pharmacy or on Amazon, and if you get it in like a gallon jug, you can refill. So just be aware that that's available. So the prevention basics are good personal hygiene. Wash your face often. Wash your hands constantly. Every time you get up to stretch, do that. Every time you go to the bathroom, do that. Every time you have to cough or sneeze, go wash immediately. Go to a no handshake policy. Doctors a lot of times will bump elbows because it's a little harder to get your elbow to touch your face, and so it's not a real good way to spread things. But you could just do air fist bumps, or you could do, a lot of people fist bump. I won't do that because it'd be too easy for me to touch that part of my hand to my face. But you can do elbow bumps, or you can just do an air high five or something like that. You need to have good nutrition, and one of the things a lot of people aren't going to like is you need to dump sugar. So, for example, if you drink a single sugary soft drink, so Coca-Cola, and I'm not picking on a brand, I could say the same thing about Dr. Pepper, 7-Up, etc. If you drink the sugared version of it, there's nearly 14 teaspoons of sugar in one 12-ounce can of a soft drink, and that will basically destroy your immune system for anywhere from 18 to 24 hours. Now, if we were in a society where there wasn't a huge threat and everything's fine, you could enjoy the occasional Coke and it wouldn't be a big deal. But you need to start switching off of those sugary things, and even though diet drinks aren't that helpful and that they have their own problems, aspartame, for example, converts to wood alcohol and formaldehyde in your bloodstream, but they're infinitely better than drinking these sugary desserts. Or try drinking water, getting some flavor drops to put in it. There's a product called Water Drops. You put that in there. You can get Mio Drops, which have vitamin B12 and some other stuff, and sometimes with caffeine, sometimes without caffeine. You can put it in your water. It's flavored. So if you're just tired of just pure water, you can do something to water to make it more palatable. But get off of that. Get off of desserts. You do not have to have cake or pie at the end. And I know a lot of people grew up with always getting dessert at the end. But if you do that during this crisis, you're going to expose yourself to a far greater risk because you're lowering your immune system. Disinfect your household with some of the things I've already mentioned, and I'll probably mention a few more here in a few moments. So keep your household disinfected. If you're going to cook on a countertop, you're going to touch countertops, you're going to fix your coffee around the coffee maker, disinfect all those areas around those devices and places you're going to be. Drink a lot of pure water. Our house has a whole house water filter, and then on top of that we have reverse osmosis, so when we drink water we're getting just water, and we actually have a meter where you can measure it, and you can buy a water meter to measure the contaminants in your water. The fewer contaminants you have, the better. You do need to stay well hydrated up until the point that you get the coronavirus, because that will help your immune system. And some people theorize that if you first get it and you drink a lot, it'll wash it down your throat and into your stomach. I don't know that that's really going to help, because it's interested in your trachea and not your esophagus. But if you got it higher than that divide line, then drinking a lot of water might wash stuff down. I don't put a lot of credence in that personally. But you need pure water, you need pure air, you need sunshine. You should try, if you can, to get outside, walk, get 30 minutes of sunshine a day. That'll raise your vitamin D levels. And then pray, because quite frankly we need it. Now, let's talk about another preventive method, and this is mask. And you'll notice this is a post from the Surgeon General, and he says, seriously people, stop buying masks. They are not effective in preventing general public from catching coronavirus, but if healthcare providers can't get them to care for sick patients, it puts them and our communities at risk. Well, if you read the whole comment, he's saying, hey, masks don't work for you, but they work for us in the medical profession, so leave the mask to us. Well, I'm sorry, that's stupid. And I'm sure the Surgeon General is a very nice person, but he should not have said that. Now, it is true that if a person doesn't know how to put a mask on properly, it's not going to do him any good. And I saw a picture the other day of a doctor wearing a mask. It was inside out and it was upside down. So that doctor was an idiot. He was not wearing a mask properly. So we need to talk about the proper way to put on a mask. But what the Surgeon General really is saying is people quit buying masks because we need them. The reality is we all need them. We'll talk more about that in a minute. Here is data from the CDC. And what this little chart does is it's talking about personal protection equipment, PPE, okay? And this is if you have prolonged contact with a COVID-19 patient who's not wearing a face mask. Now, obviously, what you should do is put a mask on every patient so that they're not coughing their viruses out their mouths. So all patients should be required to wear one 24 hours a day, okay? But notice this first chart. If you don't have any mask yourself, your exposure risk is high. You need active monitoring, and you should not be allowed to be around anyone for work for 14 days from the time you're exposed. So if someone coughs on you, you need to immediately go into isolation for 14 days. Okay, second line, not wearing a face mask or respirator. Again, same thing, okay? Third thing, you're not wearing eye protection. So you are wearing a face mask, but maybe you're not wearing eye protection. You'll notice it says the exposure risk is medium, because most of the time this virus goes through the nose and the mouth, but it can go through the eyes. So you still need active monitoring. You still ought to be self-quarantined for 14 days if somebody coughs on you and you're not wearing glasses or goggles or anything else. Now, if you're not wearing a gown or gloves, but you are wearing a mask, notice your exposure is low, and you can self-monitor. And you can basically report to somebody and tell them how you're doing. And you don't necessarily have to be removed from work. So just the fact that you're wearing a mask would make it possible for you to continue work. Now, if you're in the hospital and you're working with COVID-19 patients and you're wearing a face mask instead of a respirator, respirator would be this big thing that covered your eyes, it covered your entire face, and it had these two little things sticking out the bottom part of the mask, each with a disc that had filter material in it. But if you're just wearing a face mask and maybe goggles and you've got a gown on, again, your exposure is low and you can monitor yourself and you don't have to be restricted from work. So the bottom line, what this chart is saying is masks really do help. So ignore the Surgeon General of the United States. I understand that they want healthcare workers to have masks, and since my daughter's a healthcare worker, I really want her to have a mask before you have one. But still, you need to get your hands on a mask, and you need to wear it. Now let's talk about the kinds of masks. What you see on the left here is a surgical mask. Now, you need to be aware that the inside of this mask will be white. The outside of this mask will be either green or blue. The colored side always needs to be out, or the filter material doesn't work like it's supposed to. If so, the picture I looked at the other day, the doctor was wearing this. He had the blue side in and the white side out, which means he was an idiot who happened to graduate medical school. So make sure that you've got the blue side or the green side out. Also, there's a metal tab at the top of it, And you can see it more in the middle picture here, which that's a different kind of mask, but even the first mask has this tab. You squeeze the tab around your nose. Now, it's going to feel uncomfortable. It's going to feel like you had a very uncomfortable pair of glasses and they're riding your nose. But listen, these masks are not meant to be comfortable. They're meant to be comforting. Okay, so remember that phrase. Not meant to be comfortable, meant to be comforting. So squeeze that around your nose. Make sure that you get that mask on properly. If you don't tighten that thing around your nose, and every time you breathe, air is coming up out the top of the mask past your eyes, and basically you weren't doing much good for yourself. And you'll be sucking air in through there too. You want it to go around your nose tightly so that very little air can come in around the top of the mask. We want the air to have to come through this fabric. Now, surgical masks are pretty easy to breathe through. The next kind of mask you see in the middle picture there, that's an N95 mask. These are very difficult or impossible to get right now, but we can show you how to make them here in a moment. And this has a lot more surface area. It kind of looks like a duck bill in many regards, but there's more filter material in it because of its shape. It has that metal tab again that you're going to bend to go around, and sometimes there'll be a little valve on it because this material, very easy to suck air in through, but when you exhale, you feel like all your hot air is just stuck inside of it. So some of them have a valve that opens that makes it easier to exhale. So if you can find ones like that, they're fantastic. Then there are respirators, and you see respirators there in that little picture at the bottom right. These are full masks that have this big disc at the bottom. The disc has replaceable filter material, and they're used for extreme protection. So you need some kind of mask. Now, a lot of people in my neighborhood, maybe in your neighborhood too, are actually making masks out of cloth. And my daughter's been making a bunch of these masks for a local hospital, and she's making them out of sewing material that she wasn't using, and she put elastic in it, goes around the ears. That is better than nothing. It at least keeps droplets from getting on you, or if patients wear them, it keeps their droplets from getting out. And remember, that's the number one way this thing spreads. However, she made hers with a pocket, and I was still able to order some N95 filter material, just squares of material that you can put in this little pocket inside the mask, so that when you breathe, you are breathing through N95 material, although you appear to be wearing a cloth mask. Now, the nice thing too about cloth masks is that they can be washed, and you can add a little disinfectant to disinfect them. If you don't do that, then you need to make sure that when you take these masks on and off, do not touch the mask itself. Only touch the elastic. So touch the elastic, stretch it over the ears. When you put the mask back on, don't touch the mask. A lot of people want to take that mask in their palm of their hand and put it up there. Don't do that, because you're just getting your hand contaminated, because you've been breathing in virus-infected air through it. So always take the mask on and off by the elastic. Very, very important. Now, here's a link, and you should take out a pen and paper right now, pause the video, whatever, write this link down and go to this video, because this is an excellent video made by a doctor's wife on how you can take a HEPA filter vacuum bag, which you can still get, and she shows you exactly how to cut it, and out of every one of those vacuum cleaner bags, you should be able to make 4 masks that are pretty much similar to an N95 mask, because a HEPA filter will remove viruses. So it's superior to just a cloth mask, and I would highly encourage you. This is an easy thing to do. You need a glue gun, you need some piping material, pipe cleaner, I guess was what we used to call them. You need the mask, and you can make these kind of masks relatively easy. And she gives a very detailed video of how to do this. So again, this is a very powerful thing to do. So if you get a cloth mask, better than nothing. If you get a cloth mask you can put HEPA filter material in, that's perfect. If you want to make the entire mask out of the HEPA filter bag and just add some elastic to it, you need to go watch this video. But you need to, if you can't, you probably cannot buy a mask right now, and right now healthcare providers have precedences over masks, so any mask shipments are being sent directly to hospitals. We're not going to be able to buy any more masks for a while unless you buy them on a black market or something. So learn to make your own. Again, proper way, don't touch the mask. And you see this gentleman has the green side of his mask out. His happens to be green inside of blue, so he did the right thing here. You notice how he's using his thumb and forefinger to stretch the elastic over his ears, but he's not touching his mask. And so if the white side is out, you're an idiot. Blue or green side's out. You're doing it right, and make sure that you don't touch it. Now, again, N95 masks are not colored, but they're shaped, and it's very clear you can only put them on one way. Just make sure the metal band is at the top. Now, masks are useless if they don't seal properly. So you do need to bend the metal band or the pipe cleaner or whatever's in your mask around your nose so that it seals well. And usually healthcare professionals will also put on goggles, or they'll put on a pair of glasses at least to avoid spray getting into their face. I think everyone who's already been infected or who is potentially infected because they've been exposed to it, they should wear a mask to avoid infecting others. Because remember, you can be contagious for 14 days but with no symptoms whatsoever. So eye, nose, mouth protection, all appropriate. Again, Clorox is one. I wanted to mention one other substance. You can get something called ammonium chloride. You can often get this at pool supply stores. You can find it at Lowe's and Home Depot for people that have pools. It's a salt. It is used by a lot of hospitals to decontaminate surgical tables and floors. You can mix it in mop water, mop your floors, decontaminate your floors. You can mix it in a solution, put it in a bug spray. You could spray your countertops with other things. You don't want prolonged contact on your skin for over 3 or 4 minutes, but you could use it temporarily on your skin and then rinse your skin off to disinfect it. But you can. There's videos and information on the internet for how to mix this up. If you can't find sanitizing wipes, you could buy some of those handy wipes that you use over and over again, or blue shop towels. You can soak it in ammonium chloride and then you can wipe stuff down with it. It's very good disinfectant. Now, the important thing is you need to be able to limit the viral load. So how you get SARS-CoV-2 is very important. So, for example, if I touch a surface that's contaminated, then I scratch my forehead, I have just contaminated my face, which means I'm very likely to get the COVID-19 disease. However, what will happen is I gave myself a very small viral load, so my immune system has a chance to ramp up. So the virus is doubling every so many hours or so. But if I gave it only a little tiny dose of virus, let's say 20, if we'll call it 20 viruses, then I have, no matter how fast it grows, my immune system can keep up with it. However, if somebody coughs or sneezes into my face and I got 350,000 viruses sprayed on me, then I'm unlikely for my immune system to be able to catch up and keep ahead of the virus. So if you are contaminated, you want it to be very small contamination, which is why if you go out, wear a mask. Wear a mask. Wear a mask. This is super, super important if you don't want to get this. Now, if you have been exposed, maybe somebody did cough on you, or maybe you found out after you spent an hour talking to somebody and they just had a little cough once or twice, but they were sitting 4 feet away, you should self-quarantine for at least 14 days. I think 27 days would be better, because we know that the virus can incubate for that long. You should avoid travel. Again, keep your immune system strong, and then monitor your symptoms if you got it. Now, how do you know when you're infected with the coronavirus? Well, there's a self-checker you can go to on the internet, and I've shortened the very long URL for the self-checker. But you can also go to the CDC's website and look for coronavirus self-checker. But that's the link, and that is case-sensitive, so type it exactly like you see it there. And there's an interactive chat bot that pops on your screen, and it will start asking you questions, and you reply, and then it will tell you at the end of this little quiz whether you're likely to have the coronavirus or not, and whether you should take the time to go call your doctor. Now, the problem is that we get confused as to whether we have allergies, a cold, the flu, or the coronavirus. So let me help you try to distinguish them. So the symptoms of cold are you get aches and pains, you get a sore throat, you get a runny nose, and sneezing. And the big key here is the runny nose and sneezing, because you will not have that with the coronavirus. And so if you got runny nose and sneezing, then you probably have seasonal allergies, or maybe you just got a common cold. Flu symptoms, unfortunately, these symptoms are exactly the same symptoms as the coronavirus. You get a fever, you get a dry cough, you can have headaches, you can have aches and pains, you can have sore throat, you can have fatigue. If we look at the symptoms of the COVID-19 disease, again, what are they? Dry cough, fever, Now, if you're experiencing shortness of breath, you usually don't have this with the flu, but if your coronavirus case is starting to edge toward being more severe, you're just going to feel like you can't get your breath. And at that point, you don't need to wait any longer. You need to be talking to a doctor, or you need to be going to an emergency room. You can sometimes get headaches, aches and pains, and sore throat. The more severe symptoms, if you have real hard time breathing, if you get bluish lips or face, which means that your O2 is low, your O2 saturation, your body's not getting enough oxygen. If you're confused and it's not easy to get you to wake up or arouse, you're just kind of non-responsive, that would be a severe symptom. If you have persistent pain or pressure in the chest, all these are life-threatening symptoms. You should already be at the hospital at this point. Now, what's not symptoms? You don't sneeze, and listen to this one, you do not need lots of toilet tissue. Okay? Diarrhea or runny nose in the case of COVID-19 is extremely rare, and yet when people heard that there was a pandemic, what did they all do? They ran out and bought every roll of toilet tissue, and before toilet tissue is on the shelf again, it's already sold out. And the other day I was at a store and they had a sign that you could buy two packages of toilet tissue and get one free, but then right next to it was a sign that said limit one to a customer. So the new math thing isn't really working for me. Coronavirus attacks your lungs, not your colon. So it would be extremely rare that you would have diarrhea, and people hear the flu and for some reason they think it's their colon, and it doesn't have anything to do with that. The coronavirus is not interested in your colon. Now, another good sign that you potentially have COVID-19 is if you start having flu-like symptoms and then suddenly feel like you're better, and then 3 or 4 days later you start having this really dry, painful cough. That's the time to head to the hospital, because that's how COVID-19 often presents itself. Now, there's an important tool I think that every one of you need. You need to go out to Amazon or some other vendor, or go to your local drugstore and look for an oximeter. If you've ever been to the doctor's office, you know that they take your blood pressure, and at the same time they're taking your blood pressure, they put this little jaw-like clamp on your index finger, and it sits there for just a minute, and then it tells the person your pulse, which is how many beats per minute your heart is beating, and it tells them your oxygen saturation. Now, this is very, very important to know, because this will tell you when you need to head to the hospital. Most doctors don't want you coming in if you think you got COVID-19. They want you to make a phone call and talk to them, because they don't want you coming in their office yet. They only want to see if it's absolutely necessary under the current conditions. So a normal oxygen saturation needs to be over 92. I really prefer to see numbers like 96, 98 all the time. If I take deep breaths, I want to see it go to 100. That tells me my body's getting plenty of oxygen from my normal breathing. You should start worrying if it goes under 92. If it's in the 80s, normally you should be on oxygen by that point to get your number back up. You need immediate medical help. I was told by somebody the other day that they were turned away from the hospital, and they told them, if your number gets in the 70s, then come see us. And that's because the hospital was already pretty much overwhelmed. Frankly, if you're in the 70s, you should be on a ventilator already. So you need to go somewhere else and get help at some place that can help you. Now, what do you do if you are infected? So, first thing is, if you think you're infected, you should quarantine for a month. Again, you're going to hear everybody else say 14 days. I'm going to say a month, because, again, you can be infective a lot before you have symptoms, and after symptoms, only about 10 days. I'm just going to err on the side of caution and say quarantined even longer. A minor case of COVID-19 should be like a bad cold that lasts a couple of weeks and then you're over it. More severe cases are going to be much worse, much longer, and deeper symptoms. You should immediately if you have any kind of symptoms, have a phone consultation with the doctor. Already have taken your temperature before you make that phone call, so you need to tell them if you do have a fever or not. If you have one of those O2 sensors, tell them what that O2 sensor says. That'll let him know or her know how far along you are in this. Then you should wear a mask at all times. If you're at home, you got other people at home, wear a mask out of love and consideration for them. If you're home alone, then a mask doesn't matter. Always wear a mask when you're out. Wash your hands with soap and water for at least 20 seconds. Again, sing the Twinkle Twinkle Little Star thing. You can get Thieves Oil based hand soap from people that sell essential oils from one particular company, but just use a good hand soap or even just a bar of ivory soap, that kind of thing. Remember that that's going to break down the bonds around it breaks down the membrane bonds that are around the virus so that the virus falls apart. And then monitor your symptoms closely. If you get worse in any way, you need to let somebody know immediately. Um, Again, I would recommend using soap and water at least every hour. If you can't get soap and water, then use 60% alcohol. So you might want to find some rubbing alcohol, or you might want to find some, maybe make your own hand sanitizer. Or if you've got hand sanitizer somewhere, carry some in your car with you, because soap and water is not always available when you're out and about. Don't touch your eyes and nose or mouth with unwashed hands. We do that normally 5 to 7 times an hour. Don't let people within 9 to 12 feet of yourself. Cover your cough or sneeze with a tissue, or do what men used to do in the old days. They carried a handkerchief with them, and if they had to cough or sneeze, they'd take out the handkerchief, do it into there. But with a tissue, you can throw the tissue in the trash. You don't really want to do that with a handkerchief. You want to go home and wash it. Clean and disinfect touched objects and surfaces frequently, a couple times a day. You might want to get a sanitary wipe down your computer keyboard or your steering wheel in your car or anything else. Just remember, these things can last a while. Now, let's give some good news, because we need good news after all of this. So there's been several treatments that have been tested and very effective. So in France, they began treating COVID-19 patients with 600 milligrams daily of Plaquenil. The generic name for that is hydroxychloroquine. That's a lupus drug and rheumatoid arthritis drug. And then they would add to that an antibiotic called azithromycin. And there is a particular brand called Zithromax is one of the brands. And what they discovered is that 83% of people after 3 days of this were tested negative for COVID-19, and 100% tested negative at day 6. Now, bear in mind, I think that they found these people toward the beginning of their symptomology, and I believe, in other words, these weren't people that were already intubated or people that had pneumonia or advanced respiratory distress syndrome. So, but if you catch it early, you start having symptoms, you put it on this, then you very quickly get over the COVID-19 virus. So hydroxychloroquine or Plaquenil has been around for a very long time. The only real side effect of it is if you're a woman and you take hydroxychloroquine for an extended length of time, and I'm talking months, there's a potential that you could go colorblind, but that's usually temporary. You stop the drug and your color perception comes back. But interesting thing is that that's we don't have to take it for that long with this. We're taking it, maybe for a week, maybe for 2 weeks, but basically it's a cocktail of hydroxychloroquine plus azithromycin. Another thing you can do is take that same drug, Plaquenil or hydroxychloroquine, plus zinc tablets. So what happens is the drug opens up your cells to make it easier for zinc to get inside the cell. Zinc is a metal, as you know, but once it gets inside your cell, it destroys the ability of the virus to replicate. Basically, you break the copy machine so it can't make copies anymore. So I would say to anyone, if your doctor puts you on hydroxychloroquine or Plaquenil or even chloroquine itself, which we'll mention in just a moment, you should be taking zinc with it, because zinc is going to be what destroys the virus and makes it where it can no longer replicate. So bear that in mind. Always take zinc with these. Now, Zithromax, or the azithromycin, as the generic name is, that antibiotics cannot destroy viruses. Don't get confused by that. But this particular antibiotic stops the ability of the copy mechanism in the cell, and so the viruses can't replicate anymore. So there's a good YouTube video here by Dr. Eric Berg if you want to go see that. He gives you more detail, and he lets you meet Dr. Vladimir Zelenko, who's one of the doctors who researched this, and another thing. So here's some different trial results. So the French study had 36 patients with COVID-19. They used Plaquenil with an antibiotic. 100% recovered within 6 days. They did another trial later with 80 patients. And of those 80 patients, all improved except for two, one of which was a 74-year-old and the other was an 86-year-old, and they had other health problems. Dr. Vladimir Zelenko, that he's been cited by some as a hero and criticized by others, but he, in 699 COVID cases, he had COVID-19 cases, he had a 100% success rate using hydroxychloroquine, a Z-Pak, which again is that Zithromax antibody, and zinc. He combined all three together, and he says you got to hit this virus hard and hit it early with this protocol. So again, if you, one of the young ladies I mentioned earlier, she waited, she took 2 weeks for her to get a doctor to see her, by which time she was very, very sick. So if you get in early, and maybe you can do that with a phone call, a video chat or something, then you're okay. Dr. William Grace has had similar results, same kind of treatment, just with hydroxychloroquine and Zithromax. He's not had any deaths among his patients. The National Institute of Health did a study showing that zinc showed a decrease in morbidity, that's death, relating to lower respiratory tract infections. So zinc is very, very powerful. It needs to be part of your regimen. And there was another study done by the National Institute of Health where they used hydroxychloroquine or Plaquenil in a test tube, basically, and found that it killed the virus. Now, there's another thing you'll hear, chloroquine, and this is what President Trump has referred to more often. This is a malaria drug. It's been in use for over 70 years, and it basically does the same thing that hydroxychloroquine does. And in fact, it might even protect cells. So if you look at this little chart on the right, the pink chart, the pink line, pink dots are how much the drug inhibits the coronavirus. So you'll notice at various dosages, which is the line across the bottom, that it inhibits the coronavirus. And then if you look at the blue dots, that is the cell toxicity. In other words, how toxic does the cell become because you're putting chemicals in your body? You'll actually notice this is below zero. It starts out at zero and goes down. So this seems to actually protect cells rather than make them more toxic. Anytime you can take a drug and it doesn't make you more toxic, this is a good thing, and this is a very rare exception. Now, there's also a drug called Remdesivir. It's made by Gilead Sciences, and it has shown to relieve symptoms about 50% of the cases. So if you look at the chart for that, it seems to inhibit things more quickly, but it does have a little more toxicity toward higher doses. But it's still a very safe drug. It's just not as effective as chloroquine phosphate, which is the malaria drug. So what would I do if I were infected? Well, obviously, you need to check with your own doctor first, so I'm just telling you what I would do. I would find a doctor. I would doctor shop until I found one that would put me on Plaquenil or the chloroquine phosphate, 600 milligrams a day, and also put me on Zithromax, and then I would continue to take zinc religiously, and I would self-quarantine away from the rest of my family for at least, from the start of my symptoms, at least 10 days into the treatment, because I don't want to get them sick. Now, let's talk about, okay, if it comes, you want to be prepared for it, so you need to boost your immune system, but you want a strong immune system, but you don't want it to be too strong. So what does that mean? Well, first of all, you have to improve the biological terrain. So Claude Bernard, who lived about the same time as Louis Pasteur, when Louis Pasteur was telling everybody it was the germs that made us sick, Claude Bernard said the terrain is everything, the germ is nothing. In other words, if your body had a healthy immune system, germs wouldn't bother it, and that was his philosophy. And of course, there's a wonderful site you should all be familiar with. It's grassrootshealth.net, and they are started as a project at the University of San Francisco Medical Center, and they started researching the effects of vitamin D on the body and found out that it was very powerful in the immune system. So before we talk about vitamin D, let's talk about the immune system. You may not be aware that there are three components to our immune system, three players to it. First of all, there's the physical barrier. This is the things that are our outside surface of our respiratory, our GI tract, and reproductive system. So, for example, our skin is part of this physical barrier. The inside of our digestive system is actually on the outside of our body, because we take food from the outside of our body, it goes through, comes out on the outside of our body again. So the lining inside the digestive system is another important physical barrier. It keeps bad stuff that we eat from getting into our body while letting the good stuff through. There's also something called the innate immune system, and this is what is composed of things like neutrophils and macrophages, and this has scavenger cells that go eat up the dead cells, the garbage that's in your body, and they have natural killer cells and things of that nature. And then we have something called the adaptive immune system that adapts to new threats to the body that are from outside the body. So this would be like foreign viruses. And so there are B cells that secrete protein antibodies, and there are also T cells. And so we'll talk about the difference between those. So let's talk about the physical barrier first. So the first part of the immune system over which we have the most control is our skin, obviously. This is why we want to wash constantly with soap and water, use appropriate hand sanitizers, things of that nature. Our skin has multiple layers, and we want to make sure that we keep that outer layer protected. And if you do get a cut or something, go ahead and cover it up so it can have a chance to heal and not expose layers deeper down to outside infections and things. Your digestive system, as I mentioned, is on the inside of your body, but it's exposed to the outside world because the food travels through it. And so if you have a healthy digestive system, there's a single cell lining inside your intestinal tract that nutrients pass through in the bloodstream but keep the garbage out. However, if you eat a whole lot of inflammatory foods like a lot of grains, a lot of simple carbohydrates, that'd be sugars, desserts, sweets, etc., you can damage that lining and get what's called leaky gut. And you probably have heard a lot about that if you've read anything about health at all. And leaky gut creates these gaps in that one cell layer and lets bad stuff from the outside world into your system, and then you can have an autoimmune disease or have a reaction to it. So we need to eat healthy, and we need to wash our hands. About all you need to know about that. Also, part of the physical barrier is for our reproductive system. And if in the Old Testament, for those of you who believe the Bible, there were a lot of laws regarding safe sex and when to have it, when not to. There were even things that protected a woman's uterus by only having sex at certain times of the month so that her cervical mucus plug was in place. There were limitations for how many days after a girl was born or after a baby was born before it was safe to have sex again. All those things were designed for protection. And of course we have other things today that can help us and things of that nature. But again, we also just have to respect our reproductive system and make sure that we use it in a safe way. Now, there's the second part is this innate immune system. So there are macrophages, neutrophils, dendritic cells, natural killer cells. These things are roaming around our body all the time in both the blood and the lymphatic system. And they burrow into tissue, and they lay in wait ready to meet enemies. And if the enemy comes in, they can engulf and destroy bacteria. They can engulf and destroy cellular debris. And so a macrophage is an example of like a white blood cell, for example. It starts off as a monocyte. It slips through a blood vessel wall into tissue. There it matures into a specific kind of macrophage that will attack a specific kind of threat, like garbage in the bloodstream or in bacteria in the bloodstream, and they're laying in wait all the time for the enemy. So your immune system is constantly working. Even now as you're listening to this presentation, because these macrophages are hiding, waiting on stuff to attack, and it goes and devours them. So the immune system is designed, this particular immune system is designed to destroy sick cells, cellular waste that's cast off. It cleans out the sewer from the cellular waste in your body, and any pathogens or germs that normally occur in the human body, and you don't want them to get out of control. The third part of the immune system is the adaptive immune system, and this is the one we're most concerned about, other than maybe the exterior one where we have to wash our hands and things. But as this name applies, this system can change and adapt to new molecular threats. So this is the part of our system involved in viruses. So two particular things you need to understand about the adaptive immune systems are B cells and T cells. So a B cell makes and secretes protein antibodies that recognize specific foreign molecules. So the first time a foreign virus, a foreign molecule comes in our system and encounters one of these cells, it says, hey, I haven't seen that cell. I don't have anything in my code book tells me how to do that. So I'm going to structure myself so I know how to attack this thing in the future. And so B cells don't actually kill anything, but once they are aware of a particular virus or a particular invader to your body, they start manufacturing antibodies that do go and destroy that thing. So these antibodies then bind to the foreign molecules, which would include a molecule that has a virus in it, and they neutralize their effects. So, for example, they can bind to the hemagglutinin molecule of the influenza virus and prevent its entry into a cell. So in other words, you get exposed to the flu all the time. Flu isn't just during flu season, it's year round. We just don't think about it except during flu season. And it will prevent its entry into a cell. Now, by the way, this is why if you got a very small exposure to the coronavirus and your system had a chance to ramp up its immune system, you probably wouldn't get a bad case of the coronavirus because these B cells are going to be cranking out these antibodies very quickly and very rapidly, so that when they see other coronaviruses enter the system, they say, oh, I know what that is. I'll kill that because I'm the antibody for that particular invader, and then they come in for the kill. Problem is that if you get a whole bunch of coronavirus at one time because somebody coughed or sneezed in your face, then you don't have the opportunity to ramp that up. And by the way, in cities like New York City, where people basically are walking down the streets before all this happened, and they're bumping into each other as they're trying to get down the sidewalk, there the problem is you're exposed to so many repetitions of being exposed to it that you get a much worse case. So big cities are going to have a worse problem with this than out in the country, for example. Now, these mature B cells, one that's seen an antigen previously, has already made antibodies previously, and they keep at least one of those antibodies on the surface, and it has a receptor to it, and it recognizes any time that the antigen it's supposed to attack comes along. So in other words, it has something on it that recognizes that virus from then on, and then a signal from this receptor says, hey, I just saw one of these bad guys crank out some antibodies, and it does it very quickly and very efficiently. It's an amazing, amazing design. So both the surface and the secreted antibody can recognize and bind to almost any kind of module. So the good news is that after a period of time, most of us will have been exposed to the coronavirus. We will have developed antibodies against it, and then it won't be the huge hairy problem it is now. So, this is one of the most frequent phrases in the Bible is, and it came to pass. It doesn't say, and it came to stay. Chances are it's going to take 18 to 24 months for us to have enough herd immunity in the human population that the coronavirus is not a part of our daily news, and we kind of go back to life as normal. Now, there's multiple places in your body these B cells are made. These are the cells that crank out antibodies. They're made in our bone marrow. They're made in our spleen. If you ever wondered what your spleen did, this is one of the main things it does. They're made in our liver. Then they're made, interesting enough, in some of our body cavities. There are cells there that manufacture antibodies, which is a real good place to manufacture them, by the way, because that's where a lot of the enemies come from. Now let's talk about T cells, which are my personal favorite. So once the virus enters into a cell, the antibodies don't help anymore. Antibodies can catch the viruses while they're flowing free, and it can engulf them, surround them, and destroy them. But once they get inside a cell, you got a problem. But what happens is that T cells know when a cell's been virally infected. In real simple terms, when a virus infects a cell, it leaves a little bit of its coating on the outside of the cell. It's kind of like a rat with a long tail, and not all the tail gets inside. Or in the picture that you see there, the hot dog might be like the bun, and the frankfurter could be like the virus. And even though the frankfurter is inside the hot dog bun, part of it sticks out on each end. And so what happens is T cells recognize the end of the frankfurter sticking out and says, oh, that's the enemy. Okay, so there's a lot of different kinds of T cells, or helper cells, or cytotoxic lymphocytes. There's all kinds of things. And T cells can recognize just fragments. In other words, they don't have to see the whole hot dog. They only have to see the end sticking out to know there's a problem. So they have these T cell receptors that bind to what's called a major histocompatibility complex class 1 protein. And So when a virus enters a cell, the protein fragment from the virus ends up bound to this class 1 protein on the surface of the cell. Now the T cell binds through the receptor, this infected cell. It learns to recognize it, and then it knows how to get inside the cell and destroy the virus. So T cells are very, very important to us. And again, this is an amazing design. So your B cells destroy viruses before they get into cells. Your T cells destroy viruses after they get into cells. Now, there's some chemistry that's required for all of this immune system to function well, and this is where you get the practical what can you do, and we're nearly to the end of the presentation, so thank you for hanging with me. So vitamin D3, now we call that a vitamin. It's not actually a vitamin, but we're never going to get away from calling it a vitamin ever. It is a hormone. But D3 activates the adaptive immune system, so that's the B cell and T cell stuff. It's the equivalent when you take vitamin D3 or you get out in the sun and you're in sunlight and your body makes D3, it's like turning on a light switch, okay? Now vitamin C energizes the immune system, so it's like the electricity that powers the light. So you need D3 to turn on the immune system, and you need vitamin C to power the immune system. And also vitamin C has to convert. If you're in sunlight, your body actually makes vitamin D2, which doesn't help us, but then vitamin C converts the vitamin D2 into vitamin D3, which is what we want. And even if you take a vitamin D3 pill, it is synthetic vitamin D3. It's always synthetic vitamin D3. The only natural vitamin D3 is made when your body converts D2 to D3. But synthetic vitamin D3 works quite well. Body loves it, but it still requires vitamin C to put it in a form that your body says, oh, now I've got plenty of D3. So you should always take vitamin D3 and vitamin C together, okay? Whenever you are converting vitamin D, it consumes vitamin C. So, for example, if you're out in the sun a lot and your body's making vitamin D, the more you're out in the sun, probably the more vitamin C you need to be taking. Or the more vitamin D3 you're taking synthetically, the more vitamin C that you need because it's involved in that conversion process. Now, here's some more required chemistry. So when the immune system is triggered, and we've talked about this already, the immune system causes an inflammatory reaction, and you need a little bit of inflammation to destroy the enemy invaders, but you don't want so much inflammation that your lungs are filling up with fluid, because that's a bad thing. So if we take zinc all the time, this mineral regulates the extent of the inflammatory reaction. Basically what zinc does is it lets the immune system work at a lower level where it does its work and it's happy about it, and you have some mild inflammation systems, but it doesn't cause a severe overreaction which finds your lungs filling up before you can get to the hospital and get on a ventilator machine. Or it doesn't, taking zinc may prevent an autoimmune condition from starting as a result of leaky gut. So zinc is very, very important to us. Almost every chemical reaction in the body requires either a mineral or an enzyme. So in the case of making vitamin D3 available to the body, turning on the immune system, the mineral that gets consumed is magnesium. So at a bare minimum, here's what you need for your immune system. You need vitamin D3, vitamin C, magnesium, and zinc. Now I'm going to mention vitamin K2 in a minute. Simply, it doesn't have anything to do with your immune system, and it doesn't have anything to do with coronavirus, but it must always be taken with vitamin D3, and I'll explain why. So nutrient deficiencies are a big, hairy deal, causes all kind of problems. So this particular chart is from the grassrootshealth.net website, and they're showing if you're deficient in vitamin D3, you can have heart and cardiovascular disease, mental, emotional, and behavioral disorders, autoimmune disease, flu, colds, cancers, diabetes, pain, fatigue, sleep issues, decreased immune function. So vitamin D3, even if that's our only immune deficiency, is a big deal. Up to 75% of the world is vitamin D deficient because, for one, we don't spend all day outdoors anymore, and some of us live at latitudes where we don't get that much sun anyway. 35% or more of all healthcare costs could be saved if the population got a rating of 40 to 60 nanograms per milliliter of vitamin D3 in their blood, and we'll explain what that is about here in just a moment. More than 80% of the population are deficient in omega-3 fatty acids. This is the kind of fatty acid you get when you eat salmon or other fatty fish, for example. And there's a recommended percentage of 8% for that. 45% of the population, nearly 1 out of every 2 people, is deficient in magnesium. And magnesium helps you sleep better at night. It helps reduce muscle spasms. It helps regulate your heartbeat. And it does about 350 other things in your body. So magnesium and potassium are probably the 2 most important minerals going on in your body. So if you ever want to check your own and you don't have a doctor, so I have a functional medicine doctor, he's very careful to test all of these things, but you can go to grassrootshealth.net and you can purchase a test kit from them. Basically draw your blood, submit it back to them, they will give you the results, and then you can enter into a program where they'll recheck it after 3 to 6 months of supplementation. You can see how you're doing, and all they ask in return for that is that they will track your health statistics along with any problems you report to them, because they're constantly gathering data on how nutrition benefits our bodies. Now, let's talk about vitamin D3, because there's so much dispute and so many ignorant comments about how much can you take and how much is safe. So I want to give you a very balanced view on it, and then I'll tell you what I take. What I take is not considered balanced, but let me discuss it. So when I was in elementary school, which is a lot of moons ago, and I don't even know if they teach such things in elementary school anymore or even in high school, I remember them telling us that there were water-soluble vitamins and fat-soluble vitamins. Vitamin C, for example, is water-soluble, so if you took too much, you would just pee it out and be done with it. A fat-soluble vitamin was like vitamin A, vitamin E, or vitamin D, and the problem with fat-soluble vitamins is they would be stored in the fatty tissues of the body, so if you ever took too much of it, they said that you would create a toxic condition. Now, that's very, very true of vitamin A and vitamin E. You should never take any more vitamin A or vitamin E than your doctor tells you should take, or the minimum suggested, or the suggested dose on the jar. Because if you take too much, if you take more than the suggested dose, you can cause some pretty severe damage to your body, including liver disease. You can destroy your liver with too much vitamin A or vitamin E. However, vitamin D has never actually had a documented case of vitamin D toxicity for vitamin D3. Now, there is cases for vitamin D2, and I'll explain that in a moment. But here's a quote, and I'm going to just read the quote exactly as it is. It says, "The appropriate intake of vitamin D required to effect a significant disease reduction depends on the individual's age, race, lifestyle, and latitude of residence. The latest Institute of Medicine report 2010 indicates 10,000 IU per day is considered the NOAEL, no observed adverse effect level. 4,000 IU per day can be considered a safe upper intake level for adults aged 19 and older. It's well documented that the darker the skin, the greater the probability of a vitamin D deficiency. Even in southern climates, 55% of African Americans and 22% of Caucasians are deficient." And there's the source of that information. So the thing about the dark skin is just that dark skin doesn't convert sunlight to vitamin D as quickly as light skin does. The nice thing is, though, they don't get sunburn as easily as somebody with light skin. So, but you notice they're saying 10,000 IU a day has been officially designated a no adverse effect level. So that's a good safe value for anybody to take, and it's been backed by the Institute of Medicine. So we feel pretty good about that amount. But let's do a little common sense here. Common sense is not common in medicine, unfortunately. When you go out in the sun at midday during the summer for 30 minutes, and let's say you're wearing shorts or a t-shirt, your body is going to make 20,000 IU of vitamin D2, which then is converted to vitamin D3, and it converts to about the same amount of vitamin D3. Now remember, to convert vitamin D2 to vitamin D3, you have to have vitamin C. It's going to pull that from somewhere in your body. Okay. By the way, humans are one of the few animals on Earth that cannot make vitamin C. The healthiest mammal on the face of the planet is a goat, and goats make about 13,000 milligrams, 13,000 milligrams of vitamin C a day. And if they start getting a cold, their body automatically ramps up to making over 100,000 milligrams of vitamin C every day. And that's why goats can live out in the pasture and eat 10 cans and still be healthy. Amazing animals. Okay. So, at any rate, what I'm trying to say is if your body makes 20,000 IU just from being in the sun for 30 minutes, then taking 20,000 IU is not going to hurt you. And yet, we used to be warned in school about this. Well, The reality is there's never been a single dose of vitamin D3 toxicity, even when some little kid ate a whole bottle of vitamin D3 capsules because they thought they were candy. The kid was fine. But you obviously don't want to do that for a prolonged period of time. So what is the real test? Well, I call this as the proof is in the pudding. Everybody's need for vitamin D3 is different. So the only way to know for sure how much is right for you is a blood test. It's called the 25-hydroxy vitamin D test. You'll sometimes see it notated as 25-OHD. Any doctor worth his salt can order this test for you, and if they don't understand why that's important, find another doctor. But you want your results to be above 40 nanograms per milliliter. Now, the scale only goes from 0 to 100. Generally speaking, if you're between 40 and 60, you're going to reduce a lot of health risks. So, for example, if you have a level higher than 40 nanograms per milliliter, you have a 65% lower risk of cancer than somebody whose vitamin D is lower. That alone is worth taking vitamin D3. Type 2 diabetes risk, if you had that, is 50% lower at levels of more than 41 nanograms per milliliter. I was once diagnosed with type 2 diabetes. I don't have it anymore, but my vitamin D3 levels are quite high. So this is something, valuable tool in your arsenal. Okay, my personal doctor recommends that level should be between 80 and 90 nanograms per milliliter. Last time I went in and had my blood tested, it just showed that it was above 100, and he said you might want to back off your vitamin D3. But there was no adverse things. He was just trying to get it in a recognizable range. Now, so what is the normal accepted dosage? According to grassrootshealth.net, again, this is a medical study by doctors, they say you need about 8,000 IU per day to have a serum level of between 40 to 60 nanograms per milliliter. 90% of people fall below this level. So you should be taking at least 4,000, but really you ought to be taking 8,000 IU a day every day. Since there are no adverse events for 10,000 IU, and that's an official number, it's just easy to take 10,000 IU. You can buy 10,000 IU capsules, take that, and remember this switches on your immune system. Okay? Now, are there instances of vitamin D toxicity? Well, there are instances where people had vitamin D toxicity when doctors gave them vitamin D2 as an injection. And vitamin D2 still had to be converted by the body into vitamin D3. So I don't know why doctors would even prescribe vitamin D2 unless it was just some old traditional thing that they used to do and they're kind of ignorant. So if you do vitamin D2, yes, you can get toxicity. However, if you took lots and lots and lots of vitamin D3, and I'm talking 200,000 IU a day, every day, for a very prolonged period, you can develop what's called hypercalcemia. That's too much calcium in the bloodstream. Now, there's a condition to this, however, and that only happens if you're not taking vitamin K2. Now, by the way, there's two forms of vitamin K2. There's MK4, which only stays in your system for about 90 minutes, and there's MK7, which will stay in your system all day. So don't ever buy the MK4, just buy the MK7. So, to really simplify it, vitamin D causes your body to remove calcium from food and put in your bloodstream. But that's not where you want calcium, because what will happen is you get calcified arteries. Calcified artery or hardened artery means an artery that's it doesn't expand and contract with the blood flow anymore. It's rigid, it's calcified, it's hardened because you have too much calcium in your stream. And of course you can also have plaque and other things that contribute to that. But you don't want calcium in your bloodstream. However, if you take vitamin K2 at the same time, that causes calcium to be transferred from your bloodstream into your bones, teeth, and where it's really needed. So the two things should always go together. And there's lots of great research on this. And there was even a dentist by the name of Dr. Weston Price that went and studied primitive civilizations that never had crooked teeth or cavities, and he wondered why, and he found out it was because at that time he called it vitamin X because he didn't know what it was, but it turns out it was vitamin K2 was in their diet. So you can take a safe dose of vitamin D, just always take vitamin K2 with it. Now, There's also what's called pulse or bolus dosing. This is when you suddenly take a higher dose for a short period of time, and many doctors during viral epidemics like the one we're in will take between 100,000 and 150,000 IU a day for short periods of time. So Dr. Gundry, who's a well-known doctor and writer on plant-based health and has a number of his lectures on YouTube, he'll take, when he's working with virus patients, he'll take 150,000 IU a day for 3 days every week, and then he just doesn't take for the rest of the week because vitamin D stores in your system and it builds up a level, and he works with patients, and he's done so for 18 years and never contracted the virus. However, when he was taking less than 150,000 IU per day, because he used to try just taking 50,000 IU a day, he said that was not enough to prevent the virus. So he takes a pretty high amount. One of the doctors on Grassroots Health, he and his wife, every time flu season gets around, he and his wife both take 100,000 IU a day all the way through flu season, and I'm sure they take vitamin K2 as well, and they have absolutely no problems. By the way, best way to do this is go buy vitamin D and vitamin K2 in the same capsule, and they do have that. So, for example, you can buy a 10,000 IU vitamin D capsule that has 400 micrograms of vitamin K2 in it, which is the recommended amount, and you take them, and it's the recommended amount by most doctors at any rate. It will prevent, then you don't have to worry about calcium being in your bloodstream and hardening your arteries. Usually you want to take between 360 to 400 micrograms is the normal dose most people recommend of vitamin K2. So if I knew I had to go to the store tomorrow or 2 days from now in order to get stuff in the middle of this coronavirus pandemic, I would probably take 150,000 IU for a day or two before I went, and then I would, of course, take vitamin K2 with it and vitamin C with it, and then I would make sure I put on a mask before I went out, and I'd probably come back and be absolutely fine. So it's appropriate to once in a while increase your dosage because you know you're going to be going out. You can kind of plan in the future and do it. Now, your body does adapt to doses of vitamin D, so it doesn't do a lot of good to take huge amounts of vitamin D for a very long time. And again, you have to take vitamin K2 or you worry about the calcium thing, but vitamin D also adapts to it. So if you're taking 4,000 to 10,000 a day, and I would say 8,000 to 10,000 a day, you're not going to have any negative body adaptation. But there were some studies. So, for example, in a study called the Bischoff-Ferrari study, once a month dose of 24,000 IU raised the serum D level, that's that blood level, of people that had an average 14.9 nanograms per milliliter all the way to 55 nanograms per milliliter. Remember, you need at least above 40 to be healthy, to not have greater potential for diabetes and cancer and a poor immune system. So somebody with a 14.9 nanograms per milliliter, they're in very big danger of problems, but raising it to 55 would be a major improvement on their health. And they did that with just one dose of 24,000 IU once a month. In another group of people that had 19 milligrams per milliliter, which is still very, very low, they gave a once-a-month dose of 50,000 IU, and you can actually buy little capsules that have 50,000 IU of vitamin D3 in it. It raised their serum D levels to 80, which is where I want it to be. I want it to be between 80 and 90. Now, what you'll notice, though, is they took a little more than twice the dose, and yet they didn't get twice the effect. So there's a decreasing amount of returns to higher doses of vitamin D3 over a long period of time. But again, I would say take 10,000 IU a day, and what I told my family is I wanted them to take 100,000 IU a day for a week to get their numbers really way up there, and now just take 10,000 IU a day, which will maintain their level at a very high level. So in other words, you get your vitamin D levels up to between 80 and 90 in your blood, then you don't have to keep taking 100,000 IU a day. You can just simply take 10,000 IU a day, and that's what we're doing now in my family to make sure that vitamin is at a sufficient level. And of course, we're taking vitamin K2 with it. Now, vitamin C was the next thing on the list. It's water soluble, so it really doesn't matter how much you take. You'll only absorb what you need, and the rest will go out in your urine. Generally speaking, 1,000 milligrams at a time is all that your body can absorb, and you could probably do that 4 times a day, because it's after let's say after 6 hours or so, whatever you took is going to be probably mostly out of your system. However, the body is amazing that even though normally it can only absorb 1,000 milligrams, just kind of like the goat needs more vitamin C when it's under stress, when your immune system's under stress because you've got an infection, maybe you've not been getting sufficient sleep, so your whole immune system is taxed, needs more energy, you got poor nutrition, you're just stressed out from life, then your body can absorb more vitamin C. So if you're under a lot of stress because of this whole thing, and you are going out where there's a greater risk of things, then you need to bump up the amount. You might want to take more than 1,000 milligrams 4 times a day. I don't know what your body would absorb. Linus Pauling is the one who got his Nobel Prize for his work on vitamin C, and he recommended doses of 10,000 milligrams at a time whenever the immune system was compromised or during times like we're in now. I really think I probably would pee most of that out, but I'm comfortable taking 1,000 milligrams 4 times a day, which is what I'm doing right now. And there are a lot of good videos and data on megadosing vitamin C. So you can go out, check YouTube for megadosing. Thomas DeLauer is probably the #1 nutrition guru on the internet, and he has 2 or 3 videos on megadosing vitamin C when it's appropriate to do that. So again, I'm not trying to recommend a specific amount. I just want you to be aware of the fact that under times of stress or when your immune system is needs a little extra boost for something, you can take more, and it's just fine. You won't take too much. If you take too much, it's just going to be peed out anyway. If you have bleeding gums a lot, it probably means you're taking too little. Now, vitamin C is a very effective virus fighter, mainly because, remember, vitamin C is the energy for the immune system. D3 turns it on, vitamin C energizes it. Now, one thing you need to be aware of, though, not everything that's labeled vitamin C is really vitamin C. So our government has decided to allow people to label ascorbic acid vitamin C, but that's not. It's a precursor to vitamin C. If you want to go look for Dr. Eric Berg video on YouTube, he explains this, and he tells how they actually make ascorbic acid, and it's kind of scary. Okay, ascorbic acid is just a component of vitamin C, but it's not real vitamin C. What you need to do is look for a vitamin C that it has L-ascorbic acid, so it'll have an L-ascorbic acid, and then also it should contain some things like organic acerola cherry, or it contains citrus bioflavonoids. In other words, something that came from a plant. Then you'll know you have real whole food vitamin C. And again, I am asking my family to take 500 milligrams 4 times a day during this coronavirus. I'm taking 1,000 milligrams 4 times a day just because I'm one of those people that doesn't get a lot of sleep. My body's under more stress than others. And I'm not worried about taking too much. One of the brands I've used was called Nature-Lo, and I don't make any money off any of these things, but it has organic acerola cherry, so it's a real vitamin C. Real vitamin C will cost more than ascorbic acid because ascorbic acid is just a test tube chemical, whereas real vitamin C comes from actual plants and food. So make sure that you're using real vitamin C. Ascorbic acid not going to help you that much. Real vitamin C will. But it's very effective. Now, something else that may surprise you is mushroom capsules. Oriental countries have been using different kinds of mushrooms in their medicine for years. Now, the common little white button mushrooms, we call them, that we have here in the United States, that we use in cooking all the time, they really don't have any effect on your immune system whatsoever, and they have very few nutrients, but they taste good with butter. But other mushrooms like reishi, shiitake, portobello, some of those actually boost the immune system a good deal. And so I take mushroom capsules. One I use is here in this picture from a company called Organics, and it's called 7M Plus. It's called that because it has 7 different kinds of oriental mushrooms fermented and then dried, and these capsules made out of it. And it has an amazing boost to your immune system. So that's something else you can do. So what am I taking? Here's kind of my summary. Right now I'm still taking 50,000 IU a day of vitamin D3 normally, and I do that because I've got a lot of other things going on. I've had diabetes in the past, which I no longer have. I want to keep it at bay. So if I'm going to go out, I'll take 150,000 IU for 2 to 3 days before I'm out and about. Or if I know I might come within 12, 15 feet of somebody that has it, because maybe I'm going inside a grocery store, which I'm trying to avoid at all possible times right now. I'm taking between 500 and 1,000 milligrams 4 times daily. If I feel any symptoms of a cold or flu, I'm going to boost that to 2 or 3 times that. So if I start getting a sore throat, you're going to see me taking 2,000 milligrams 4 times a day. I'm taking vitamin K2, that's 400 micrograms a day, and I do that consistently. That amount never changes. That's the MK7 variety. Taking magnesium, about 500 milligrams a day. Sometimes if I'm having muscle aches and pain due to a couple of spine injuries I've had over the years, I may increase that to 1,000 milligrams per day. Be aware of the fact that magnesium citrate is a form that can cause you to have diarrhea if you take too much of it, but there's other forms like magnesium malate that absorb better into the body, and there's probably 2 or 3 other kinds of forms. Again, look for Thomas DeLauer's video on magnesium, and he will go over all the different forms for you. I'm taking 30 milligrams of zinc daily. I'm taking omega-3 fish oil, which doesn't really have anything to do with your immune system, but it helps reduce inflammation in your body, helps you keep your waistline under control. If you're pumping iron, this is really something that's good for you to take. But I'm taking 6 grams, that would be 6,000 milligrams daily of omega-3. My omega-3 numbers are kind of off the charts, and that's where I tend to keep them. My doctor's very happy with that. But again, that doesn't have anything to do with the immune system, so feel free to ignore that if you like, but it is good for your heart health. And then I'm taking the 7M fermented mushroom capsules. And again, that's just the brand I take. You can go to your health food store and find a brand there. So let's close with one final topic, and that is the government doing the right thing right now? And I really want to tell you that I sympathize with our president, with our governors, with our leaders, because they have a very touchy problem here. Number one, they want to stop the pandemic. They need that R0 value to get below 1 so this thing dies out and goes away. And to do that, they have to have very tight containment and isolation. The only way we're not going to spread it to 6 other people, which is about the going rate for this thing, is if we're not around 6 other people, which is why we're in containment. However, we also have a problem with needing to keep the economy going, and that's very difficult right now because all our restaurants are shut down, all our theaters are shut down, all non-essential businesses are shut down. And so what they've come up with, and they're doing this to achieve this goal number 3 down here, which they want to keep the infection level low enough that hospitals don't become swamped. In Italy, they're doing ICU in the hallways of the hospitals. We don't want that here. We want to make sure that the ICU can handle it. And in some of our cities here, we're already raising tents to build tent hospitals out in the middle of soccer fields in order to put patients out there because the hospitals themselves have run out of room. So we need to keep the hospitals working. We don't want them to be overwhelmed, and so we do this thing called keeping the curve low or keeping the bump low or whatever you choose. Flatten the curve is the phrase that's there. And so we have to quarantine to keep that low and just let a little bit at a time, and there should be lots of little waves. A bunch of people getting sick at a time going to the hospital, but only little waves of it. And so when we see these restrictions released, they'll probably be a little bit at a time, and they'll probably be in certain areas of the country at a time. The problem is that we need to keep the economy going too, because if people don't have jobs, they're not going to be able to buy vitamins and medicine and secure health care and feed their families, and they're going to get sick from the stress, and some of them are going to kill themselves over the stress. And it's sad, but that's the reality of it. And we're already approaching Great Depression-like effects, as our unemployment has gone from the lowest in history to just about the highest in history in a very short period of time. So this is not an easy balancing act. So I'm personally of the opinion that nobody can say what's right here. It's kind of like they're going to have to do the best they can. And I have one friend who every day says, well, we've only had 9,464 deaths in the entire nation. Why have we shut down our own economy? We've only had 339 deaths, or no, actually like 900 and something deaths in Texas. So why have we shut down the entire economy of Texas? And he makes a good point. He makes a valid point. However, I also know that I don't want to be one of the people that gets the coronavirus because you were out in society, coughing around, not wearing a mask, and you did it in my face, and then I have to worry about a huge case fatality rate that makes my future not look very good if I got a high viral load when you cough on me. So, it really depends on which perspective. Right now, I'm kind of more concerned about the economy than I am my health because I'm already taking reasonable health precautions. But I also know a lot of people stupid are not going to do that. So I don't really know the answer here. I mean, I call it the good, bad, and ugly. I mean, I think we knew about the coronavirus at the end of December. I think it was January 8th that Trump shut down travel to and from China. He was really smart to do that so quickly. And of course, we soon enacted other travel bans in place. Then, the bad is that now we have these shelter in place orders all over Texas where I live and probably where you live too. There are some states that don't have that. Oklahoma right now doesn't have shelter in place orders as I make this recording, and they may be appropriate for us. Maybe Oklahoma spread out further, doesn't have as many problems with this, but we've gone from the best economy on record to near Great Depression levels unemployment. That makes me unhappy. It makes me worried about my friends whose jobs are in jeopardy because their companies aren't making money. So what the government has decided to do is what I call the ugly. They're printing $2 trillion of money to release in a bailout, but a lot of it's not going to the small businesses and the people who need it. It's actually given a raise to Congress. Nancy Pelosi and company made sure they got a raise. It got bigger salaries for administrators in the Lincoln Center. One of them makes like $1.3 million a year. That's a pretty good salary for running a place where they throw concerts. I'd like a job like that. So the matter is that nobody is going to do good here. If Trump really shuts everything down and destroys the economy because he's trying to save lives, he'll be criticized. If he opens the economy back up, but then more people die as a consequence, he's going to get criticized for that. So either way, he's getting criticized. He's going to be the bad guy in all of this by the time the next election rolls around, and it's going to be a real question as to whether Americans are perceptive enough to understand the politicizing of this whole thing or not. The other reality is that I don't know how fast the economy can come back. Let me put this $2 trillion in perspective for you. That is 10% of the existing national debt that we authorized in spending on one bill. So all of our debt added up through the entire country's history till now, we took 10% and authorized it in one bill. That's a very scary fact. So there's really no good here. I don't think there is a perfect solution. There's not a perfect solution. I have a friend who would just like us to let everybody loose and let them do their thing, and people that die will die, and we'll get over it because in 1918, 1919, with the Spanish flu, 650,000 Americans died, but we only had a 4% unemployment after the whole thing was over, and the economy came back robustly and thrived. And there was no $2 trillion bailout. There was no shelter-in-place orders. I understand his perspective, but I also understand that this disease is more virulent. It spreads faster than the Spanish flu. It has a higher case fatality rate, and so it's very difficult for me to know where the decision is. I do know that you have to be very careful in using government statistics. A lot of countries are giving kind of useless data because they're not doing extensive testing. So here in America, when we say we have so many cases right now, the reality is we probably have 4 or 5 times as many cases as reporting because this only shows people that have tested positive for COVID-19, and we're not doing extensive testing. Probably the only 2 countries on the face of the planet that are doing a really good job of testing for COVID-19 are South Korea and Taiwan. There, they have checkpoints everywhere. You drive up, and they measure your temperature. They give you a COVID-19 test. If they find out you got it, they track down everybody you've been with in the last 48 hours, and they go test them. That's pretty robust. And a lot of countries don't even test anymore because they say, hey, the coronavirus is so widespread here, there's no point in doing tests anymore. It's endemic. Everybody's going to get it. there's going to be a huge impact to our entire nation. So on the left of your screen here, you see a picture from a satellite of China with a sensor that's measuring nitrogen oxide, basically, or nitrous oxide, basically pollution from manufacturing. And you will notice that in China, this huge orange area that you see on that leftmost picture taken on January 1st of this year shows there were a lot of production, a lot of manufacturing, and then China has to quarantine everybody and shut all the businesses down. And you notice all that orange goes away. Basically, it now looks like North Korea in terms of its manufacturing. In other words, practically non-existent. A graph of their road congestion from year to year. You see the 2020 line at the bottom. Roads are no longer congested. Otherwise, they'd be congested. So if you look at 4 weeks, 2 weeks, then the Lunar New Year, which is when traffic always drops down because it's a holiday, everybody stays at homes and celebrates. Then 2 weeks after Lunar New Year, what you notice here is that on Lunar New Year, which was in late January 2020, is that basically traffic hasn't really started coming back. And an interesting fact that I'm still waiting to have explained is that the number of cell phone subscribers in China is now down by 21 million people. Now, China hasn't told us that all that many people have died. It sounded bad to begin with, and they were reporting it to begin with. Now they're not reporting basically that anybody's dying. Maybe 3 new deaths a day or something, but they're not admitting to anything over 30. So either China has solved the crisis, which is highly unlikely, or there's a reason there's 21 million fewer cell phone users. A lot of people are out of jobs, can't afford them. The Chinese government does have a plan that will provide you a basic cell phone, and the government provides it so that you can stay connected. But 21 million fewer users, you've got to wonder how many people have died. And there have been riots in China recently because not enough urns for the ashes of the deceased ancestors that need to be collected. So we can't really trust the statistics. Also, again, this is the example of the guy that's quoting the mortality rate and telling us all to be calm, and he is, the assistant secretary for the Department of Health and Human Services, and it's kind of like, this isn't that big a deal. But he's referring to the overall mortality rate, which right now is not that bad because we're just getting started. But the case fatality rate is another number, and it's shocking altogether. And some companies are using whole different terms. One blogger, Twitter feed that's a health professional, she does a lot of calculations, and there's a whole bunch of these feeds, but basically there's about a 2-day supply for medical professionals across the nation. I know my local hospital's getting short on masks. Hospitals in New York and some of these hotbeds for the coronavirus are in desperate condition. People are asking for you to donate the masks that you have, etc. And the good news is that private industry in America is doing what America always does best, which is to respond. MyPillow.com, this guy started making pillows in the United States when most of them were imported to give Americans jobs. He's a Christian man. He's started a company that honors his principles. Well, in less than a week, he converted his factory from making pillows to making 50,000 masks per day. Now, I'm hoping he ramps it up even more than that because there's one hospital in New York that goes through 40,000 masks a day. So this is barely putting a dent in it. But I admire the fact that he retooled his whole factory and within 2 days was making 50,000 a day. And I hope by now he's making 500,000 a day. Tesla and Ford are also doing things like making ventilators or making other personal protective equipment. I'll close with two verses of scripture, and I know not everybody's a Christian or maybe even a spiritual person, so if this offends you, I'm sorry, but I just want to share 2 verses. We all need wisdom. We need wisdom to know how to take care of our families during this crisis, as well as our leaders need wisdom. And God says in James 1, if any of you lack wisdom, let him ask for it from God, who gives it to all without reservation and reproaching, and it will be given to him. So we need to ask for wisdom, and we need to be around wise people to get answers. Don't just listen to what the media feeds you, but ask for wisdom to make wise decisions, to discern. And finally, I think this is an interesting verse of scripture given recent history. Most Christians are familiar with verse 14, but not with verse 13 in 2 Chronicles 7. It says, when I hold back the heavens so there's no rain, and when I command the locusts to devour the earth, and I send disease among my people, then if my people who are called by my name will humble themselves and will pray and will seek my face and will turn from their evil ways, then I myself shall hear from the heavens and will forgive their sins and heal their land. And three things to notice about that. One is it mentions all three recent events that have happened. Some of you know in Australia there was a large drought and widespread wildfires. In Africa there was a plague of locusts that devoured a huge amount of plant life, and now we've got the coronavirus all over the world. And it mentions all three of those things in the first verse that's there. And then the other thing to notice is it's not everybody that has to pray, because obviously a lot of you are not Christians. A lot of you don't call on the name of God, and that's by your choice. But it's not calling on you to pray. It says, if my people who are called by my name. So that means that the Christians need to humble themselves and pray. Jews should humble themselves and pray and seek his face. And we have to turn from our own evil ways, repent of the things we're doing that don't glorify the Lord. And then God says, I'll hear from heaven, so I'll forgive your sins and heal your land. Personally, I believe the coronavirus is going to be a problem that's bigger than government's ability to solve. It will be up to the resolve of the American people and the people of the earth to properly practice good hygiene and good practices, and practice having a strong immune system to put this thing at bay. But I also believe that it may very well take a miracle. And so those of you who believe in prayer, it's time to get started. I appreciate that. I appreciate your willingness to listen to this presentation. If this has been of any kind of help to you, if it's provided you information you didn't know before or given you suggestions of things to pursue, then I would strongly encourage you to give this a thumbs up and share it with others. And I understand that some people won't like the way I close this, and that's fine. And my intention is not to offend, but to inform. And I hope you found some information in this presentation that's helpful to you. Thank you.